सर 2 मिनिटं तुमचं इंट्रोडक्शन.
लगेच चालू करायचं.
सर हा सर बोल येतात
चालू करायचं.
आता लगेच 9 वाजताचा टाइमिंग.
माझं तर 9-10.
Hello. 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 A very good morning to all of you. Esteemed speakers, chairpersons, and all delegates. I, Dr. Hannah Bashir, co-organizing secretary of this webinar, on behalf of Department of Anatomy, Nair Hospital, welcome you all. Injustice anywhere is a threat to justice everywhere, and that is why law is made. This law is implied to medicine, forensic medicine, which is resting on structural basis of human life, that is anatomy. Knowledge of anatomy is used as integral part of forensic and medicine for medical legal reasons. How these all are linked, let's discover through this webinar. We would be starting with the keynote address. Our speaker for the keynote address is Dr. Shailesh Mohote sir. I request Dr. Shraddha, co-organizing secretary of this webinar, to welcome Dr. Shailesh Mohote sir with the Tulsi plant. I feel proud to introduce our esteemed speaker, Dr. Shailesh Mohite sir, who is Professor of Forensic Medicine and Toxicology and currently working as Dean of HBTMC and Cooper Hospital. Sir was former Medical Superintendent and Professor and Head of Forensic Medicine at TNMC and BYL Nair Hospital, Mumbai. Sir is also the President of Medical Legal Association of Maharashtra. Let me not be further between him and his talk. I would like to invite Dr. Shailesh Mohanty, sir. Sir, please come.
Good morning, good afternoon, and good evening, ladies and gentlemen. As the organizers have told me that people from different part of the globe have joined for this program, I stand over here to give the keynote address in this CME on forensic anatomy and medical laws. Importance of anatomy in a doctor's life. When you are born, the first words probably for a child that is taught are from A, Amma. When you go to school, you start with A for apple. Similarly, when you join medical school, you start with the first subject, A for anatomy. And that forms the basis of our whole medical education. Let us see what is the history of anatomy, what is forensic medicine, what is the legal system, and how we are interconnected. History of anatomy is rich and fascinating journey over thousands of years. Let us have a brief review. It started in ancient civilizations and can be traced up to Egypt, India. In ancient Greece in the 4th century BC, Greek physicians and philosophers, including Hippocrates, Aristotle, made significant contributions to anatomical knowledge. Since that formed the basis for further treatment, it was largely based on animal dissections and observations, as human dissection was prohibited at the time. During our college days, we had dissection of animals. Now it has been stopped. Even in pharmacology, even at postgraduate levels, now the dissection of animals has been stopped. In the Roman era, during the 2nd century, the most influential figure in ancient anatomy, that is the Roman physician Galen, he dissected animals extensively and used his findings to make inferences about what would be the human anatomy, how it differed, which dominated Western medical thought for centuries together. In Middle Ages, anatomical knowledge in Europe stagnated largely due to religious and cultural taboos about human dissection. Now also, in very few countries, we have dissection. In the Muslim countries, we do not have dissections because we do not get bodies over there as they are abandoned in our country. So what is done for dissection over there? It is the models that are used or virtual dissection that takes place over there. Renaissance period, 14th to 17th century, it marked a revival again of the interest in anatomy. And scholars like Leonardo da Vinci, Andreas, William Harvey made groundbreaking contributions to the field through human dissection. 18th and 19th century again saw further developments in anatomy, including systemic anatomical terminologies and establishment of anatomical society and schools. In the modern era, that is the 20th and 21st century, anatomy has contributed significantly to evolve with advancements in imaging techniques such as MRI, CT scans, allowing for non-invasive visualization of the human body. Additionally, the integration of anatomy with other disciplines such as genetics, molecular biology has further expanded our understanding of human anatomy and physiology. And the latest things that have come are the anatomy virtual dissection table. During our times when we had various sections taken mounted, now that need of mounting such specimens has gone away, because on the virtual table, you can take cuts at any level, visualize various organs in different directions. You can move it 360 degrees and you get the total picture about how the organ is. Year-wise distribution of anatomy topics vary according to country and according to medical schools. With the National Medical Commission, there are various changes that are brought about. In few countries, anatomy is distributed throughout 4.5 years of the MBBS curriculum. For us, what we have divided is we have general anatomy, which tells us the basic concepts and organization of the human body. We have systemic anatomy, where we study anatomy system-wise, musculoskeletal systems and associated features. We have regional anatomy, and that is how during our time also dissection used to go on. Supex, infex, HFN, neuroanatomy, which was very intense, complicated that time in identifying, has now become very simplified through use of virtual tables. So here we studied the whole of nervous system, including brain, spinal cord, peripheral nerves, its supply. Clinical anatomy. At the end of the answer, it was, we had to write what is the clinical anatomy or what is the correlation, how this topic is going to help me in my clinical practice. Embryology. Starting of the human body, that is the human embryo fetus development, including how it developed into mature organs later on. Histology, what is the microscopic picture? So when we advance to second year pathology, we could understand what is the disease process, how it has taken place. Surface marking, which probably has gone away since almost 2 decades, 2 or 3 decades. During our time, surface anatomy was very important, by virtue of which we would know what is the location of the organ in the body, where it is. Extremely important for those who became surgeons. Incisions taken according to the surface marking. Now also, if you see plastic surgery, the operations, you will find people first making markings according to the points, then the dissection goes on. Anatomy and forensic medicine are closely related fields. Knowledge of anatomy is crucial for understanding. I need to understand when I dissect, what are the anomalies, what could be the variation in the position of the arteries, etc. So there is no misinterpretation. For collection of evidence, interpreting forensic evidence, all these purposes, it is very important. Skeletal anatomy, yes, from a forensic point of view, it is very, very essential. 4 important things which we find out in forensic medicine from the knowledge of anatomy is the age, sex, race, and stature. 4 important things based on my anatomical knowledge. Dental anatomy. Now we have a separate branch called as forensic odontology, where we not only find out age, but goes a long way in identification of the person through the dental characteristics, if any implants have been put, any cap, any other dental procedures done. Not only that, to take it further, the bite marks, the teeth impression that are caused will help us to find out the accused or the suspect. We could also collect swabs from that area to detect DNA from the saliva, which will help us in absolute fixation of the perpetrator of the crime. Soft tissue anatomy, not only in forensic medicine, but sports medicine has evolved a lot. And therefore, soft tissue anatomy is very, very important. not only for us as forensic experts, but even for sports medicine experts, where we study the anatomy of soft tissue, the muscles, ligaments, organs, and these helps in treatment of sportsmen as well. Neuroanatomy. Now, neuroanatomy is very essential for neurologists, neurosurgeons. We have cases where cases of paralysis come and thrombectomies are done, and by afternoon, the individual walks as if nothing had ever happened to us. We have few cases from my institute in where knowledge of neuroanatomy has helped people in treating such cases. Cardiovascular anatomy, again important, and lots of developments where previously people had to undergo surgeries. Now it has become almost non-surgical, and from cardiovascular surgery, all the procedures has shifted to cardiology. Therefore, in today's world, there are very few takers for CVTS courses. Anatomical variations, as I said, one needs to know what could be the variations, what are the likelihoods, etc. Forensic anthropology. As a forensic experts, very key aspect of our forensic knowledge, because not only of human anatomy, but we also need to know certain bits about animals, their anatomy, because at times carcasses that are found in jungles or at places, one needs to find out whether they are human or non-human in origin, their time since death, etc. Radiological anatomy. In our time that students, it was very minimal. Now it has become very extensive. Radiology forms the prime branch for which medical students aspire to be. Understanding anatomy, very essential for not only forensic scientists, but also pathologists who perform autopsies. It will help to interpret forensic evidence and provide crucial information for legal investigations. As I said, development in many of the branches have occurred. So also anatomy has advanced. A forensic anthropologist needs to have a sound view of human anatomy, embracing fetus, newborn, infant, juvenile, and adult individuals. Good understanding of anatomy is essential for forensic scientists because when they visit the crime scene to collect evidences, cadavers in body donation programs can be used to verify and demonstrate the anatomical basis of certain lesions in forensic contests. Both the forensic science medicine expert as well as anatomy both work in these places. How do we work in a mortuary? Similar cabinets are also available with Department of Anatomy. You dissect in a dissection hall, we dissect in the mortuary, but dissection hall is again a common area where both of us work, the forensic expert as well as anatomist, and the third person involved with working with us is the clinician. As these dead bodies, which are with anatomy or forensic, are now used extensively for research purposes, for medical education. So the hands-on training takes place for departments like ENT, orthopedics, plastic surgery. So this is how now there has been an integration between all the three subjects. Forensic anatomy is an emerging one and helps us to collaborate and examine the cause of death. Term human anatomy deals with the way the parts of the body, right from molecules, interact to give rise to cells and tissues, and how development takes place. And this is important to me as a forensic expert when we find fetuses which are brought to us for examination, and I need to know my embryology well as to what are the things that must have developed how do I assess the age from the developmental changes, from the development of organs, finding of ossification centers, where they are present. All these things will help us. Two major parts is macroscopic and microscopic anatomy. So we would take this inherent relationship is evident in analytical processes also. In fact, the relationship between both the fields of anatomy and forensic is undoubtable. Human anatomy forms the basis. As I said, we should have wider knowledge. These things we have been integrating, but now at the university level also, those universities which offer a degree in forensic anthropology. Now, which are the universities which give such degrees? One such university I know is GFSU, where one needs to study. These universities needs to understand the role that medical, biological, humanities, and social sciences should be all knowledge of all these things should be given to the students so they have an extensive foundation of human anatomy. Also, along with it, legal knowledge needs to be added. Anatomical science is important in both medical and forensic education and investigation. It is therefore the need for collaboration between anatomy and forensic education and investigation with forensic scientists. We had vertical integration, we had horizontal integration. So in vertical integration, during forensic medicine classes, if an anatomist could come and give knowledge about what is, for example, while teaching cases of asphyxia, if we could recapitulate the dissection of the neck, where the structures are present, then the forensic scientist, forensic expert would come into picture and say, these are the areas which get constructed during hanging, during strangulation, and what would be the effects of obstruction of those vessels or other structures in the neck. What force would be required to break the cervical vertebra, and in which circumstances it would break. This collaboration will create opportunity for change of ideas required for proper investigation in forensic sciences as well as employment opportunity. Forensic clinical anatomy, practical application of anatomical knowledge and methods with substantial clinical and surgical procedures and evaluating medico-legal problems associated with it. Role of embryology has been extensive for development. Fingerprints, footprints, obviously when one is adult and at crime scene we pick up, but fingerprints are very essential. They are very, very unique fingerprints, very individualistic for every individual and do not match with any other. They can be easily picked up. There are various techniques to pick it up. So notably, the patterns are encoded at the interface between the dermis and it cannot be destroyed except in cases of leprosy, electrocution. These are the cases where the ridges get destroyed and therefore in those cases we cannot. Or if a criminal is wearing gloves, then in that circumstances one will not find. Using this knowledge, the researchers have documented fingerprint into various patterns, arches, whorls, loops, and composites. Other prints, which are of anatomical significance but not very routinely used, are the ear prints. Voice analysis, yes. Nowadays, in cases of threats given, voice recording, you do not know, at times our students also record our voices. If we say something to them, they, through hidden gadgets, devices, they would record their own viva and come and ask you, you have given me less marks, I have answered. So all these things need to be kept in mind. Age determination, we are anatomically, what is important or how is age determined by a forensic expert would be from the general characteristics, that is the height and weight, the secondary sexual characteristics. So here again, not only anatomy, physiology also comes into play. So the basic sciences are very important in forensic medicine. So we need to know the development of teeth, appearance of centers of ossification, their closure, as well as secondary sexual characteristics. As age advances, the changes that occur at old age, not only that we need, I have cases where we have done CT scans to find out closure of sutures to determine the age. This was in addition to the secondary sexual characters. Secondary sexual characters could vary, but closure of sutures usually have a fixed pattern. Role of osteology, yes, as I told you, fusion of the sutures is very important. So in dead bodies or skeletons found, it becomes easier for us to do that. But in living, role of CT scan plays a very important role in finding out all these things. If the whole skull is found, no issues. We can get n number of things from which we can determine. We could also, if there are fractures, we could also collect those break in continuity, I would say, to find out whether it is an antemortem break or a postmortem break. Difference between the male and female pelvises to find out how much time is required. Knowledge of anatomical variation is important. As I said, some of the things is you could have situs inverters, you could have dextrocardia, developmental defects like sternoburium fusion can be misinterpreted as stab wound, old stab wound. Kidneys ascent from pelvis if not seen, or then there could be a confusion. GI tract, there could be malrotation, diaphragmatic hernias, cryptorchidism, testis fails to descend. All these things one need to look for. Exhumation. Now, this is one important aspect where role of both anatomy and forensic medicine is very pivotal. And there are few cases where we have done exhumation with the anatomists from this department of anatomy at TNMC. Excavation refers to removal of the other buried evidence such as drugs, weapons, materials, etc. Now here first and foremost during exhumation comes the legal part of it. Before going on with the exhumation, who has ordered for? Is he authorized? Most importantly, am I authorized to go and do the exhumation? All these are legal aspects. You might be an excellent worker. You might crack the case. You might do everything meticulously. But if you are ignorant about the law, then you are in deep, deep trouble. If you have gone outside your jurisdiction and done without proper authorization, then that is not permitted by law. Anyone can remove human or remains or other evidentiary material from the earth. However, when the recovery is undertaken by inexperienced people, several problems can occur. People who are not well versed, they say, okay, now question is only of identification. So I need not dig out the whole grave. One long bone is sufficient for me to take the DNA. But it is not only identification or absolute identification through DNA, but there are various other factors, whether male, female, age, sex, time when the person was buried, cause of death. There are about 12 to 13 points which one needs to determine during exhumation. So one needs to remove it. Not only that, one needs to find out whether the skeletal remains are only of one individual or a group of individuals, whether it is mixed with animal bones also. And when would such a thing take place? It takes place usually in rural areas where the body is buried over there only. So the same pit might be dug and again it might be put. So carcasses or skeletons of previous animals or humans could be over there and they could be intermingled. And during doing all the process, it needs to be videographed. It needs to be photographed. All these things are going to go as evidence in court. Therefore, one needs to remember that. Conclusion, there is need for collaboration in today's world. among anatomists who are interested in forensic education, investigation with forensic scientists. This collaboration will create opportunity for exchange of ideas required for proper investigation in forensics as well as employment opportunity. Before I conclude, certain laws which are related to anatomy. First is the Bombay Anatomy Act. Second is law related to genetics. I know few of our colleagues are doing genetics, and just as Mumbai Municipal Corporation, Bombay Municipal Corporation is progressing, wherein in Gynac we have now brought IVF at one of our centers and are offering to the general public. A day will not be far when Department of Anatomy will have a genetics lab. And therefore, one needs to know what are the laws related to genetics, laws related to donation of body, what are the various GRs related to it, and one needs to follow the law of the land to the hilt. Laws related to embalming, who can do embalming, where it can be done. Not only that, people would ask you questions about what are the rules to send body from this city to another city, to another state and another country. So what are the laws? When it can be sent, when it cannot be sent, what are the documents required, where I would get the document, where I would get the authorization, how do I book a flight, how do I book a train for all these purposes is very, very important. Thank you very much. I thank the organizers for having invited me for this keynote address and my best wishes to the further program. Thank you very much.
Thank you, sir, for your inspiring words. Now, I would like to call upon Dr. Sumed, sir, to felicitate Dr. Mohite, sir. For all our online participants, we are just starting in 5 minutes. There'll be a delay in 5 minutes. I'm sorry for that.
Has been ये वेबिनार एक काम करना पड़ेगा ये जो है ये जो दिख रहा है ना इसमें कौन सा
आपको
आपको
पता है ना कहाँ पे?
इसके अंदर सुमित सर का अलग सबमिशन You share it directly. There is
Check.
ये on
The topic for our next session is examination of skeletal remnants, forensic perspective. Chairpersons for this session are Dr. Deepak Joshi sir. I request Dr. Shraddha ma'am to welcome sir with the Tulsi plant. Dr. Deepak Joshi sir is professor and head Department of Anatomy, Grand Government Medical College, Mumbai. On 26 January 2023, sir received certificate as Best Professor and Head of Department from the Dean of Grand Government Medical College. Our second chairperson for this session is Dr. Rajendra Bable sir. Dr. Rajendra sir is joining us online. Welcome, sir.
Thank you.
Sir is former Joint Secretary of MCI. Dr. Rajendra Bable sir is Dean, YCM, Postgraduate Institute, Pune. Our speakers for this session are Dr. Shyam Kishore sir. I would request Dr. Shraddha ma'am to welcome Mrs. Shyam Kishore with the Tulsi plant. We are fortunate to have her presence today. Dr. Shyam Kishore sir is professor and head Department of Anatomy at TNMC and DYL Nair Hospital, Mumbai. Our second speaker for this topic is Dr. Sumed Sonavane sir. Dr. Sumed sir has done his postgraduate and PhD in medical anatomy from BJ Medical College, Pune University. He is the first PhD candidate in medical anatomy since the commencement of Pune University. Dr. Sumed sir has a keen interest in law. Hence, he has extended his education as PG Diploma in Forensic Science and Related Laws, LLB and LLM in Criminal Law and Criminal Administration from Mumbai University. He has also qualified for UGC NET in Criminology. He is currently pursuing another PhD in Law from Mumbai University. He was awarded for excellence achieved in academics by Honorable Chief Minister of Maharashtra State. Being evaluated as a forensic anatomist, he was involved in certain medical legal cases as an expert. Today, he is going to enlighten us on the examination of skeletal remnants, forensic perspective. Now, I would like to hand over to Dr. Shyam Kishore sir and Dr. Sumed sir for their talk.
Thank you, Dr. Hana, for your kind introduction. Respected teachers, colleagues, and my dear students, I welcome you all on behalf of Department of Anatomy TN Medical College and BYL Nair Charitable Hospital, Mumbai, for the international webinar on forensic anatomy and medical laws.
An examiner has kept this inspirational on the X-ray plate and answers were in a Christian manner. Is it actually of a living person or dead? The student replied living. Examiner sees and asks why. Then, why will you take an X-ray of the dead person? Where will why do we need to take X-ray of the dead person?
Because dead men do tell tales. So how it would help us to analyze the death of the individual who has kept his or her skeletal remains with us. So there are certain analysis already discussed in keynote addresses. So first is heavy metal poisoning. So all these heavy metals, just like lead, arsenic, cadmium, even copper. So all these heavy metal poisoning, they are settled down in the bone and they prevent epiphyseal union with the diaphyseal union. So that heavy metal poisoning, whenever you are giving a bone for examination, so this heavy metal poisoning can be assessed whether the death happened with the help of heavy metal poisoning, and that has been visible. Yeah, sorry for the technical glitch. So heavy metal poisoning is uh, the thing which you can easily identify with the help of long bones. Then another thing is diatom examination. So these diatoms, there is one fact about diatoms. So whatever the oxygen available on Earth, so 40% oxygen is prepared by these diatoms, because all these diatoms, they are present in freshwater bodies as well as marine water bodies. So in the cases of drowning, these diatoms mainly goes into the lung, and through circulation it goes to the bones. So whenever you are examining this bone, so one can easily identify the diatoms available over there, so that in the cases of drowning, the water body sample can be reassessed and the drowning case can be evaluated further. And another thing is DNA analysis. So whenever there are some issues with some skeletal elements, so that issues can be assessed with the relating DNA analysis. This DNA analysis can be taken out through the long bones. So femur is the ideal bone for DNA analysis. If femur is not available, some other long bone is utilized. And if even the long bones are not available, the molars are the ideal thing. Through the tooth pulp, DNA can be analyzed and it is correlated with the living members or blood relatives. So let us discuss the examination of skeletal remains of forensic perspective. I would like to tell you a story regarding this Ajinala massacre. In the wall, here, 282 soldiers of 26th Native from Bengal Infantry Regiment met a brutal fate during the 1857 uprising, drowned in a well by the British East India Company. Earlier, it was thought that all these skeletons, they were victims of India-Pakistan partition. At that time, these victims were killed and buried in the Ajinala well. So Cooper's book provided clues that helped locate the 1857 Kalyanwala martyrs well beneath the Gurudwara Singh Sabha in Ajinala. So in 2003, the historian Surinder Kochar found a reference to Ajinala in a discarded book titled Crisis in Punjab by Frederick Henry Cooper. And later, this Kochar's research led to the revelation of Ajinala massacre, a grim incident hidden for over 157 years. So actually, these were the soldiers who were fought or revolted against British East India Company during 1874. So the well was excavated in 2014, exposing the skeletal remains of the soldiers. During the 1857 Sepoy Mutiny, many Indian soldiers revolted against the British. Around 500 revolted at Mia Mir cantonment in Lahore. The DNA-based evidence confirmed that the remains belonged to the soldiers of 26th Native Bengal Infantry Regiment. And in this way, this is actually the significance, the major significance of skeletal examination. So our objectives for today's session, participants should be able to discuss steps involved in the skeletal examination, then the medical legal importance of the skeletal examination. The first step, when we found any of the skeletal remains, so the first question arises whether it is bone or something else which is resembling to the bone. So one can easily identify these bones with the help of gross anatomical structures and microscopic examination. In the microscopic examination, you will get a nice lamellar pattern over there. However, in nowadays, there are hardly any chances to get a original bone set as. However, everyone is getting a bone set which is like to the original one. Even with the help of weight, they have managed the bone sets. So such type of bones or artificial bones can be discriminated with the help of this gross anatomical structure and microscopic examination. Then another thing is source, whether they belongs to human or some other species. So here also, human bones are peculiar with certain shape, anatomical characteristics. This is because, human being is the only animal who is having a erect posture. So his bones have already modified accordingly. Then with the help of microscopic examination also, one can easily determine the lamellar, with the help of this lamellar pattern, the source. Because this microscopic examination, the lamellar pattern, they are also identical one. And another test is also called as precipitin test, which is valid up to 10 years. This precipitin test is antigen antibody test. So this test is also a significant test which can see the antigen antibody, just like, whenever you are assessing the blood groups, the similar pattern, you can use this precipitin test to identify the source. Then the name of the bones, whenever such skeletal elements are found, so you need to name the bones on the basis of gross anatomical structures. So all these bones can be arranged in anatomical position so that one can easily get whether all bones are there or some of them are missing or any duplication is there. In certain cases, this is also very important because we had already encountered in some of the cases there are more than one bone sets available in the skeletal remains. So here you can easily say on the basis of number, size, and sides of the bone, because there are certain bilateral bones, and if they are more than two in number, so again this is an addition of the bones. Then age and gender, because they are also showing some specific characteristics uh, between male and female bones. Then some morphological similarities are also seen in a bone belonging to single individual. Then one can use shortwave ultraviolet light, and which is valid up to 35 to 100 years. So this shortwave ultraviolet light, when you throw the light through the bones, if the bones belong to single individual, they are traveling with the same frequency, same wavelength rather. Also similar way X-ray comparison of trabecular pattern, because right and left trabecular pattern of the same body is individual. So in this case again, one very important thing is there, whether it belongs to one individual or more than one individual. So whenever there are skeletal, because it has already been found skeletons of uh, twins, identical twins, at that time you need to assess the DNA pattern. So if DNA pattern are also found in similar way, so at that time you will have to come in generalized features. So what are the generalized features? Snugly fitting of the joints, because every individual is having this snugly fitting of the joint, and this is the individual characteristics. So for this such cases, you need to come from specific to generalized feature. Now let us move towards the age of the individual.
The left-hand side, open. Left-hand side, see the time of appearance of epiphys of long bone and then fusion with diaphysis. Instead, the time of appearance of epiphys and their fusion with diaphysis is as arbitrary as telephone numbers of contact and may very well be referred to as and when required. Because of this, we were very elated when we were in first year. At least we don't have to study that. We thought we knew everything. When you think you know everything, then a maturity. When we reach forensic, we realize they taunted us saying, "Hey, you don't even know this much. What else they taught you in anatomy?" Every time we became depressed, and we felt we knew nothing. If you realize you know nothing, you get a master's degree. Then we found out that even experts do not know the date and time. They refer to their charts. When you find out that even others don't know anything, you are awarded a PhD.
Now the age of the individual. So as already discussed in the keynote address, the forensic odontology is quite helpful for determining the age. So the dental status, if skull or mandible is available, that is again very important aspect. And then there is one more angle that is also called as anatomical angle or gonial angle, or also called as forensic angle. So this angle is located at the outer aspect of the ramus, and the body meets at that point. So that point is called as gonion, and this because of this gonial angle, it is measured with the help of an instrument that is called as goniometer. So that angle is measured. So this is specific to the age related thing. Then we can also refer the ossification data or radiological ossification also, the gross anatomical and radiological ossification. The secondary changes, that is closure of the skull sutures. If you see, the closure of the skull sutures started at 40 years of the age, and facial sutures, they started at the age of 70 plus. So sutures, they are skull sutures mainly, they started closing from inside to the outside. Then some bony joint surfaces, if you see or if you observe the pubic symphysis, there are again demarcated age-related changes. And then the medullary index is also quite interesting to determine the age of the individual, because as the age advances, this will increase. And this is actually the ratio of outer diameter of the inner diameter of the bone to the outer diameter. This happens in case of the long bones. So medullary index is also one of the indicator to determine the age of the individual. Now let us discuss gender of the individual. So if you see the gender of the individual, so on the basis of general characteristics, so female bones, they are lighter as compared to the male bones. Then average weight, if you get a entire skeleton, the average weight of the male skeleton is around 4.5 kilogram, and in case of female, it is 2.75 kilograms. So these are the average values. Then if you see the vertebral column length, in male, it is 70 centimeter, in female, it is 60 centimeter. Of course, there are certain additional constant. They are in the form of soft tissues. Then some of the anthropologists or forensic anthropologists and anatomists, they have studied on the regional basis the clavicular length of male and female, the diameter of the head of the tibia, then the diameter of the glenoid cavity. So all these things, they are readily available. So one can easily refer to this data. Then there are certain specific changes in the individual bones. So just like now, if you get the pelvis, you can easily say the gender or determine the gender by accuracy of 95%. If you get only skull, so here you can easily see the male and female differences of the skull, the prominent superciliary arches, orbits, the shape of the orbits, and the cheekbones or the zygomatic bones. So on the basis of skull, if you get only skull, you can 92% accurately comment on the gender. If you are getting only long bones, so you can comment 80 to 85% correctly on the basis of this gender. Long bones plus skull, around 96%, and long bones plus pelvis, around 98%. Pelvis plus skull, of course, 98%. One can comment on the accuracy of the gender. Then there are certain indices, as already I have discussed. Those indices, so whenever you are calculating any index, the index is a ratio of smaller value to the larger value to the smaller value, and multiplied by 100. So normally it is a ratio of breadth to length multiplied by 100. So sacral index is also there. Then there is one more index, that is ischiopubic index. All these are not a regular indices. I am just showing some of the indices which are not commonly in practice. The corporobasal index, that is calculated by the ratio of transverse diameter of the first cervical vertebra to the transverse diameter of the base of the sacrum multiplied by 100. Then sternal index. Then there is one more formula, as already we have seen, this Buchanan's formula. So average weight of the male skeleton is 5 kg, and in case of female, it is 2.5 to 2.7 kg. That is Buchanan's formula. Then let us move towards the forensic imaging. So this forensic imaging. So the very first slide towards the picture in the slide towards the left. So that indicates the living individual, and another indicates the dead individual.
So how one has to differentiate? There are two films. One is called as inspiratory film. Another one is called as expiratory. So in inspiration, you will get 7 plus anterior ends of the ribs, and the diaphragm is below the 7th rib. And if you get 7 minus anterior ends of the ribs and the diaphragm is above that thing, so that indicates basically expiratory film. But for some of the individuals, they can hold their respiration for that while. So this is again one more additional point is here the arrow indicates the air in the first point, air in the left ventricle, then air in the pulmonary arteries, and the lungs, they are already collapsed. So diminishing of the air in the lungs. So because they are collapsed one. So this is how one has to discriminate between the X-ray film or radiograph of male individual, living individual and the dead individual. Then OPG, that is orthopantomogram. This is quite in use. Recently, we have used for so many cases this OPG. This indicates the impacted tooth. The tooths are not there. So impacted tooth indicates one of the classical factor for determination of age. Then another point is ossification. So here you can see the upper end of the femur uh, humerus, which is showing unfusion. So that non-union is basically seen in radiological images. However, this union can be easily seen or can be easily observed in the regular gross anatomical bone. So it is little little later time. Radiological union takes place little later, and that is one of the accurate to calculate the age of the individual by ossification. And one more thing is that it is the known fact that females, they are having this ossification fusion 2 years earlier as compared to males. Then there are certain things which one should easily notice at the epiphyseal end. Here you can see a darkened line which prevents fusion of epiphysis with the diaphysis, which prevents and which will prolong with the help of this. This is actually, these are called as lead lines. So lead is heavy metal. So this fusion takes place little more time. So here you will get actually the epiphyseal plates which are darkened. So these are actually shadows of heavy metals. So they are accumulated over there. So these are lead lines. Then one can easily find out the foreign object detection, just like, in the form of any bullets, pellets, or some parts of weapons, which can be easily determined. Of course, in thoracic region, this is determined for soft tissues, and earlier you can determine for skeletal element also. Here you can determine the foreign object also, any other than bullets, pellets. Now let us move towards the racial differences. So nowadays, the term race is not used because it comes under racism. So the term race do not exist in human species today. However, the old racial categories were based on externally visible traits, primarily skin color, features of face, shape and size of the head, body, and underlying skeleton. So this was actually American Association of Physical Anthropologists statement on biological aspect of the race, which were published in American Journal of Physical Anthropology during 1996. So instead of racial categories, the earlier racial categories were based on certain features. So primary races and blue and blacks classification. So earlier primary races were divided into 3 categories, that is Caucasian, white, Mongol, yellow, and Negroid black. So this white, yellow, black indicates the skin color. according to Blumen Bach's classification, that is Caucasian, Mongoloid, Ethiopian, American, and Malayan. So nowadays, instead of race, you can term it as an ethnic group. So what is this ethnic group? Ethnic group is nothing but culturally, socially, or you can say culturally, socially, and geographically isolated group of population. So they are ethnic groups. So these were some earlier calculated racial indices, the cephalic index. So again, on this basis, the cephalic index, the dolichocephalic, that is long-headed individuals, mesatecephalic, that is medium-headed individual, brachycephalic, that is round-headed individual. So all these individuals, they are based on this cephalic index. Then there is one more index that is called as brachial index. It is actually a ratio of length of the radius to the humerus multiplied by 100. Then crural index, ratio of length of tibia to the length of fibula multiplied by 100. Then intermembranous membranal index, that is ratio of humerus plus radius to the femur plus tibia multiplied by 100. Then humerofemoral index, of course, it is a ratio of length of humerus to femur and multiplied by 100. And there is one more additional index, that is pilastric index, which is actually the index which is concerned with the linea aspera, that is anteroposterior length, ratio of anteroposterior length to the lateral length multiplied by 100. All these indices has already been calculated by earlier anthropologists and some of the anatomist also. Then there is one more index that is called as Cunningham's index, which is actually the development of lumbar curve. So which is calculated through ratio of sum of posterior height of the lumbar vertebrae to the sum of anterior height multiplied by 100. And on this basis, the classification is kurthoarchic, orthoarchic, and polyoarchic. So these, if the indices are above 100, so that indicates the absence of strongly developed lumbar curve. So this is because of in certain races, there are certain habits, or you can say these are some occupational things, based things. So one can easily determine on this basis. Then sacrum length breadth index, maximum ratio of maximum sacral breadth to the mid-ventral straight height multiplied by 100. And on this basis, the classification is dolichocheric, subplatyheric, and platyheric. So it indicates the size, that is narrow, medium, and wide size of the sacrum. Then there is additional index that is called as sacrum curvature index. So that is ratio of mid-ventral straight height to the mid-ventral core height multiplied by 100. And it has already been calculated in anthropoids, that is ape-like, then Indo-Australians. So these Indo-Australians are nothing but the Australians, they are of Indian origin. Then Negroes, Khoisans, Turanians, Aryans. So these are the, you can say, various ethnic origin. They were already calculated by certain or studied by certain anthropologists. Then height index is also there, height index of the skull. So it is a ratio of breadth to the height multiplied by 100. Then again, nasal index for the skull. For the skull, nasal index is different, and for living, it is different. So here in living, you can use the nasal cartilage. However, in skull, you can use the ratio of nasion to the anterior nasal spine to the nasal breadths multiplied by 100. So these are the ratios. Then stature. Stature can be calculated by for body height. So if there are certain mutilated bodies or some bones are not found, so even from that, there are certain formulae which were studied in Indian scenario, as well as some foreign authors also. So that is called as use of multiplication factor. So upper half and lower half of the body is divided up to the superior surface of the pubic symphysis, that is upper half of the body and The later one is called as lower half. Then if you calculated length of the full extended both upper limbs, so that also indicates the height of the individual. Then the length from suprasternal notch to the pubic symphysis multiplied by 3.3. So that is also giving an average height of that individual. So length of the upper limb multiplied by 2 plus 34 centimeter is a constant studied by that. So these are certain regression formulae through which one can calculate the length or the height of the disease. So length between olecranon process and tip of the middle finger is actually 5/19 of the stature, and length of the vertex from the chin, vertex to the chin multiplied by 8 is indicating approximate height of that individual. Of course, there are certain soft tissues also there. Then vertebral column gives 34% length of total height of that individual. If you get entire skeleton, so plus 2.5 plus 4 centimeter, that is soft tissue. So that also gives the entire height. Then ulna multiplied by 6, radius multiplied by 6.3, humerus multiplied by 5, tibia multiplied by 4.2, fibula multiplied by 4.4, and femur multiplied by 3.6. When these bones are found in isolation, so these are certain regression formula, so through which one can easily determine the stature of that disease. So there are two authors. One is Shah Siddiqui. They are of Indian origin, and one is Carl Pearson. So they are of foreign origin. So these are certain formulas you can utilize. Then weight or humid bones, you can add 7 mm in case of femur, tibia 5 mm, and in case of humerus, you can add 3 mm. That is an additional constant. Then regression of the stature is happening 1 mm per year, or you can say 2.5 centimeter per 25 years. So that is regression of the stature. Now, the most important point, that is identification. So what is this identification? So there are certain congenital abnormalities or deformities. So they can also be find out. So that is acquired peculiarities in the form of injuries, fractures. The fractures could be a pre-mortem fracture or post-mortem fracture. So this can be determined. Then determination of the blood group from bone marrow, also determination of DNA also. And that is done by this benzidine test, and that lasts up to 150 years of that skeletal age. And tooth pulp is also plays important role, because tooth pulp is the thing which is last decade. Then if you see human evolutionary ladder, so for the first thing, that is Ramapithecus, which have been found in Shivalik Lake. So that Ramapithecus, we were found only the mandible remnants or fossils. Then age, gender, race, and stature of the individual can be find out on this identification basis. Then radiological examination is also plays very significant role to find out these indices. Then there is one story that is called a giant story.
Whenever the person was quite because of the tumor, the people did not know what was the cause. John had to let that they made sure that after he died, his bones were all locked and in a coffin and buried in the night so that people do not know where he is. Here, what you are seeing is John standing in front of anterior museum skeleton. How he managed that, you can only make your own guesses.
So there are certain other things which are associated with this giant story. So he has got a wide pituitary fossa. So he might have pituitary tumor, and that leads to a gigantism. Then besides that, there are certain other abnormalities one can find out, that is in the form of I'm sorry, I was muted. So this giant skeleton, in giant skeleton, it was found that he has got pituitary fossa. So probably he might have pituitary tumor. Then besides that, there are so many things which you can determine, but I am just emphasizing some of the things, that is Eagle syndrome and abnormal scapula. So the Eagle syndrome is excessively long styloid process. So this excessively long process is basically calcification of stylohyoid ligament. So because of this, the person is suffering from continuous neck pain, and most of the time he is having difficulty in certain pronunciations also. So that is Eagle syndrome. I have found one of the Eagle syndrome in one of the medical legal case, and in the same medical legal case, I found the unusual scapulial. So this scapulae, apart from fracture, because some congenital anomalies are also there. So what is this congenital? Some ossification center may not form. So on that basis, the muscle attachment is accordingly, and the person cannot move his or her the joint as such, and the movement is restricted on that basis. Then in some of the cases, you may found malformed femur, which could be congenital or acquired. Then this is again a very important thing to be taken in consideration, that is squatting facet over tibia. This is present in habitual squatters, which are basically the Asians. They are habitual squatters. So which is this squatting facet is on the anterior-inferior aspect of the lower end of the tibia, and this is because of the shearing of this anterior-inferior part of the tibia over the talus. So why such things are very important? Because if you are in a city like Mumbai, Delhi, Calcutta, or Chennai. So all these metro cities, they are having a population over the globe. So you never know that you will find which skeleton. So for that matter, ethnic origin is also very important. So this is one of the factor. Then in certain cases, we'll have to determine the manner of separation. So state of soft tissue, if available with the marks or bite cut. So if the person is killed by certain animals, wild animals, so the gnawing marks or bite marks can be easily seen on the bony surfaces, and whether you'll have to determine whether it is natural or artificial. So these things are also important. Then cause of death. So this is totally depend on any injuries, fractures, whether these are the pre-mortem and post-mortem fractures. So how do you determine these fractures, pre-mortem and post-mortem? If the fracture is pre-mortem, then there is additional seepage because the person is living and the circulation is going on. So there is an additional seepage, and that seepage cannot be, that stain cannot be easily go away. However, in antemortem, post-mortem fractures, you won't get such seepage over there. And even though some stains are there, so these stains, they are easily washed out. So that is how you can differentiate between pre-mortem and post-mortem fractures. Then foreign bodies in the form of the bullet, pellets, or any piece of weapon. And you can also send these things for chemical analysis to determine the cases of chronic poisoning. Then the time since death. So this is basically a state of soft tissue if available. So this totally depends on various climatic conditions. So if the body or the deceased body is at Rajasthan, places like Rajasthan, that is deserted area. So where you will get extremely hot conditions. So there you will get formation of mummy. So mummification, these are certain things which are very common in the areas of Rajasthan. If certain bodies, they are found in Paschim Maharashtra or the dry weather, so where you will get the proper skeletonization. which happens over there. And if certain bodies, they are found in Himalayan regions where you'll get a very less temperature, so entire body is preserved over there. So you can see there are certain mammoths fossils, they are found with the hairs intact on their skin also. And if you found the bodies in the area like Mumbai, which is you can say humid atmosphere. So in the humid atmosphere, there is a process that is called as saponification. So it is a Latin word that is formation of soap. So that is partial skeletonization is observed in the dead bodies in the area around humid area around Mumbai and periphery. Then there are certain changes which can happen due to putrefaction. So you can earlier changes you can easily see with, so you can determine the time. Then carbon dating is the more is one of the accurate process. So that is also called as a radiocarbon dating, or also called as 14 carbon dating. So this is isotope which is present in the living element, and this is depending on the presence of this C14 element, that is radioactive element. It is there, so it goes on decaying. So on that basis, the carbon dating can be done. So up to 60,000 years or 6 million years, you can calculate the age back in certain dating. Then amino acid content, the fresh bones contains around 15 amino acids, and over 100 years, there are only 7 amino acids in the bone. Nitrogen content similar way, 3.5 to 5 gram percent around 50 years, then 2.5 gram percent over 350 years. So these are certain additional studies and findings I'm quoting over here. So you will have to consider the ultimate upshot of this element, all these points, and then you will get the more conclusive reports. In some of the cases, there are certain soft tissues which are present over the body. So such bodies, they are coming partially skeletonized bodies, they are coming burning cases, drowning cases, or any other cases, such maceration where the maggots, they eat the flesh. So that is maggot formation is there. So they are introducing some cattle dung also. So these maggots, they then further fly, and that pupa stage, they eat the soft tissues. So that is maceration. Then for that matter, in the keynote address, Dr. Mohite has already explained that it requires a collaborative or the team efforts. So it is not only the job of anatomist, it is job of anatomist, forensic medicine, and one more, that is forensic scientists. They are also a significant part for certain things. So we are also examining the bones. So there are 12 points. So one has to determine these points. So if you see the anatomy, first 6 points, they are best for the anatomist. That is whether it is bone or not, whether it belongs to human or not, whether names of the bones, whether it belongs to one individual or more than one individual. Then age is also there, source is also there, gender, stature, race, cause of death, time since death, then manner of separation, and identification ultimately. So these are the things when you try, so you'll go to the conclusive outcome. This was one of the skeleton at the crime scene we have examined in March 12, 2012. This was the skeleton found in one water tank. So these were certain, so team of our crime, team visited, forensic medicine people and anatomists visited to the crime scene. So visit of crime scene is also very important factor. Then there is a challenge for these small bones, that is carpal, tarsal, metatarsal, metacarpal.
the old-fashioned style of examination. Asking the style of isolated sample, memorized for the occasion, and rightly forgotten thereafter, has happily disappeared from modern curricula. However, they revert back in forensic medicine where they are expected to calendarize.
So this is how we have arranged in one of the case where entire skeleton was found. So these are the collaborative efforts. So one has to arrange these bones so that one can easily see the primary level, prima facie duplication of the bones. Then it has to, the custody has to be maintained. So these are our reports, whether it is bones, so bones, human, then one individual or more, all bone belongs to single individual. This was one of the report. Then age range is mentioned, then gender is mentioned, stature is mentioned, then cause of death, time since death, and manner of separation and identification. And we further send this bones for blood grouping, DNA analysis, and for facial superimposition. So one has to have this conclusive outcome. So it is possible when we utilize all the resources to evaluate the skeleton. So these are some of the references I cited. Thank you very much for your patient listening.
I would like to call upon Dr. Joshi sir for a moment regarding the session.
Hello, am I audible? Hello,
Hello.
am I audible?
Hello. So very good morning to all. Thank you first to Dr. Shamkishar sir for arranging this wonderful one-day workshop or CME what you arrange in collaboration with that of the forensic medicine and with a good key address to begin with, by which the overall coverage was given in brief by that of the Dr. Mohite sir. Dr. Sumit, you have made a very good presentation today and given the idea regarding that of the estimation of the how to estimate the sex, age, height of any deceased whose bones are received to the department. Now the estimation, that means whenever we get the body to the Department of Anatomy, normally, we go for maceration immediately. The anatomists are expected to give the age
the sex of the deceased, the height of the deceased, and if possible, on gross, you can comment on the injury if you come across. Actually, this is the work, as you rightly said, it's a collaborative work between anatomy and the forensic medicine. In practical way, I will say few things which we are doing since last so many years. In Maharashtra, Government Medical College, Aurangabad, Nagpur, Miraj, Ambezogai, Pune, and Mumbai, and after that now Dhule, are the recognized centers by the government to give the opinion on the skeletal remains received to the department. So whenever the skeletal remains they come to the department, most of the time lot of soft tissue is present, and the postmortem examination is already done by that of the medical officers, depending upon the which taluka place or district place the body is coming to the department, or at the district place where the forensic department is there. The postmortem examination is done, then the body is shifted to the anatomy department. That is the normal protocol that we are getting since long. Once it comes to the department, as usual, first and most important thing what we have to see that as per the criteria laid down or as per the various districts which comes under the Mumbai, whether the body is coming from that particular area or not. And then we accept the body for the process of further evaluation. That is the criteria which is there. And as far as possible, we have to help the department, police department, so that they can reach to the victim. Anatomists, whenever get fully ossified, that is adult about 25 or 30 years of the age, you can say 25 years above, maybe 60, 50, 70. The problem comes that how to give the opinion over that of the age. Sex we can determine, no problem. We never say that probably. Whenever we are getting the skull and the pelvic, then we can reach to the sex of the deceased, saying that the bones belongs to male or female. The height also we can give as the formula is rightly said. And regarding the age, the problem comes. So in that case, normally we refer our Grey's Anatomy, one book. Second is the Modi, that also we refer. Third one is the Reddy. Now, frankly speaking, now Reddy's book, when I came here in the Mumbai from that day, we are referring to the Reddy's book. In Aurangabad, when I was there, because basically I'm from Aurangabad Medical College, our professor and head has made a very good chart and all the things necessary to give the opinion of that of the body received from the police department. So the comparison by the various books which has been given in relation with the estimation of the age and the sex identification, other points. So lot many times the police department, whenever they are coming to us, they expect that we should give the opinion regarding the sex properly, age properly, and if possible cause of the death. Nowadays, as the DNA fingerprinting is there, it has become very easy to go for the determination of the sex also, for which they are asking to us to preserve the certain bones, for which they can give it to the forensic lab and they can give the opinion. So today's lectures, lots many points are there which he has described. Out of that, the Department of Anatomy, our department, is mainly concerned with the skeletal remains which are there. As he said, time since death, it is not possible for us to calculate whether it is an antemortem or it is a postmortem. One of the case that I came across in the Dhule, where the skull was received and there was a bullet injury at the center. The questions as usual were asked, whether the bones are of human or not, what is the sex of the deceased, age of the deceased, time since deceased, antemortem, postmortem. So I make a contact with forensic department and ask, sir, what to be done when it is asked antemortem or postmortem? Is my opinion necessary, or you will be giving the opinion regarding the antemortem or postmortem? At that time, what now the Sumer has told correctly, the seepage. The sir has given me one point that whenever you are getting the antemortem injury, please kindly observe the injury proper. That is mark, that is bullet injury which is there. And if you are getting some red tinge around that, then you can go for the pathological examination, histopathological examination of that particular bone. So on that day, I came to know that this we can make an antemortem and postmortem differentiation proper. So in this way, the various things are there, and every medical college in the state government, in our state, should take the responsibility of giving the opinion on the skeletal remains. The very few medical colleges which I told you earlier are doing this work. And another thing that even if they are not registered, the forensic department, they can take the help of the anatomy, at least in relation with that of the identification of the age and the sex of the deceased. So I'm very much thankful to this organizing committee, to the sir for giving this opportunity to come and share my views in front of you. Thank you very much.
Thank you, sir. Over to Dr. Wabe.
Good morning, everybody. Good morning, Dr. Deepak Joshi, sir. To begin with, regarding the topic, I have one or two questions for Dr. Sumit. One of the question that curiosity just came across me as to whether with the help of skeletal remains, we'll be able to identify whether the person was a right-handed person or a left-handed person. So if you could just elaborate on that, are there any markers in the skeleton that help us identify the handedness of the person?
Thank you, sir. So there are certain criteria. If you see, especially we could comment on the basis of power hand. So some of the individuals, just like Sachin Tendulkar, they are writing with left hand. So they are saying, it is said that he is left-handed, but his power hand is right hand. So in that case, you can determine on the basis of if both the skeletal elements are available, right and left skeletal elements are available. If you see precisely, so you may get more prominent muscular markings on the power hand. Thank you, sir.
Okay. And one more thing that came to my mind was whether the radiological fusion of epiphysis with the diaphysis is taking as an appropriate time, or anatomical fusion has to happen to say as to the exact time of fusion of epiphysis to determine the age.
Okay, sir. There are two elements for this aspect. One is radiological aspect. Another one is gross anatomical aspect. In gross anatomy, if you observe, so that ossification takes place from outside to inside. So if you take a radiological examination, even though in gross anatomical features, you can say the fusion, but in radiology, you cannot see that fusion because it is not fused completely. So one has to say that the radiological fusion is accurate one. Thank you, sir.
Okay. One more thing that came to my mind is there any correlation between, or are there any references regarding the correlation of skeletal elements, bones, with that of the maybe skin fold thickness, or how fat the individual was, or how obese the individual was, or his skin fold thickness, the amount of fat that he bore. Why I'm thinking in that way is because ultimately what we are aiming at is identification of the person with the help of his features. Now, the most important thing, if we could get from the information gathered from the skeleton, is uh, the picture of the person with the help of maybe skull and facial reconstruction. Now, in facial reconstruction, the most important constraint that we come across is what was his skin fold thickness, so as to give proper features to his face. So, are there any references wherein we could draw a conclusion of how or what was the skin fold thickness or what was the fat content in the skin, so that the facial features could be properly constructed by forensic anatomists or forensic experts?
Yeah, thank you, sir, for the question. Sir, there are actually no standard reference available for such thing. However, the nasal indices or the skin fold thicknesses in regional studies, if the studies are regional and the data is published in a good journal, so that reference can be counted. So far, we are only calculating whether the individual is muscular or not. On that basis, one can able to comment whether this fellow is showing some prominent muscular markings, so prominent muscles are there. So besides that, some for facial reconstructions, you may get the nasal indices, facial indices, upper facial index, lower facial index, and total facial index, orbital indices. So these studies may help for the reconstruction, because reconstruction in Indian scenario is not happening, but the superimposition is happening in the forensic sciences laboratory in at Chandigarh. Thank you, sir.
Okay. 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 Thank you, Dr. Sumit. I thank the organizers.
Program. So we'll continue after that. Huh? We'll continue this session.
Hello. Hello.
वाबळे सर आता इनॉग्रेशन प्रोग्राम नंतर आपण हे कंटिन्यू करू डिस्कशन.
Okay. Okay. Thank you. Thank you so much. Thank you.
Good morning. Good morning, one and all. I, Dr. Dattatreya Dombe, Additional Professor in the Department of Anatomy and Organizing Secretary, welcome you all for inaugural program. Firstly, I would request Dr. Sneha Sharma, our PG student, to sing the invocation prayer. Dr. Sneha.
Hello, I hope I'm audible. Am I audible? Okay. So good morning, everybody. I'll be presenting an Abhang, Tukaram Maharaj's Abhang in front of you. Please excuse me if I do any mistakes. वृक्षवल्ली सोयरी वनचरे वृक्षवल्ली सोयरी वनचरे वृक्षवल्ली सोयरी वन
वनचरे वृक्षवल्ली आम्हा सोयरी वनचरे पक्षी सुस्वरे मालवेती वृक्षवल्ली आम्हा सोयरी वनचरे वृक्षवल्ली आम्हा सोयरी वनचरे येणे सुखेरुचे एकांताचा वास येणे सुखेरुचे एकांताचा वास नाही गुणदोष अंगायेत वृक्षवल्ली आम्हा सोयरी वनचरे वृक्षवल्ली आम्हा सोयरी वनचरे आकाश मंडप पृथ्वी आसन आकाश मंडप पृथ्वी आसन रमेते क्रीडा करी कंठाकुमंडलू देह उपचारा कंठाकुमंडलू देह उपचारा जाणवितो वावसरू वृक्षवल्ली आम्हा सोयरी वनचरे वृक्षवल्ली आम्हा सोयरी वनचरे हरिकथा भोजन परवडी विस्तार हरिकथा भोजन परवडी विस्तार हरिकथा करुणी प्रकार सेवो रुची करुणी प्रकार सेवो रुची तुका म्हणे होय मनासी संवाद तुका म्हणे होय मनासी संवाद आपुलसी आपुलसी वृक्षवल्ली आम्हा सोयरी वनचरे वृक्षवल्ली आम्हा सोयरी वनचरे पक्षी सुस्वरे आळवेती वृक्षवल्ली आम्हा सोयरी वनचरे वृक्षवल्ली आम्हा सोयरी वनचरे Thank you.
Thank you very much, Dr. Sneha. Now, I would request our co-organizing secretary, Dr. Shraddha, to welcome Dean Sir with Tulsi plant. Thank you, Dr. Shraddha. Thank you, sir. I request Dr. Shraddha to welcome Mr. Satish Wagole sir with Tulsi plant. Thank you, sir. Now, I would request to our honorable guest on the dais to light the lamp. Among us, we have Mrs. Wagole, Madam also. I request Dr. Shraddha to felicit Wagole Madam with the Tulsi plant. We have Mrs. Sham Kishore sir also among us. I request Dr. Okay, thank you. It gives me a great pleasure to introduce our respected Dean, Dr. Sudhir Medekar sir. Sir pursued his MD, DNB in dermatology, venereology, and leprosy from GSMC and KM Hospital. He secured first rank in MD dermatology. He has more than 12 publications on his credit. He started first advanced phototherapy in India at GT Hospital, Mumbai. He also started PG studies in dermatology department in Marathwada region. He was previously head of the Department of Dermatology at GMC Aurangabad. He is a very good academician and administrator. He is very meticulous in his job. With his able guidance and exemplary leadership skills, sir has been instrumental in uplifting the outlook of our institute. I request our Dean Patron, Dr. Sudhir Medekar sir, to give inaugural address.
Good morning, everybody. Honorable guest, Satish Ubale, Satish Wagole, the Honorable Secretary of Law and Judiciary, our Head of Department, Sham Kishore sir, esteemed teachers, practicing professionals, and dear my students. It gives me immense pleasure to inaugurate this international webinar on forensic anatomy and medical laws. Looking at these medical laws and relation with this forensic anatomy, I like to go into basics. A justice delayed is a justice denied. And what we require, justice are delayed, we require a robust evidence. Any justice system requires a robust evidence. In terms of that, I think medicine laws are interrelated. Among that medicine, there are two important branches, I think. One is anatomy and second is forensic medicine. These two branches are very important because ultimately it helps to deliver a justice which is not on an arbitrary basis, a justice which is based on evidence basis, a justice which can give very quick, early or expedite manner. And there is a thing very important, and appropriate relief to the victims will be there. Hence, over a period of many years, or I think in the current setup, these branches are very valuable, important aspect in a justice or judicial system, or I think say the science of law, which is called jurisprudence. It's my introspection or there, or my, I think, thinking is there. Nowadays, there are no modern technologies are available among that analytical laboratories, which can help for all this forensic anatomy, and second thing about the forensic medicines. Example given, all spectroscopy, Raman spectroscopies are there, infrared microscopies are there, which are used nowadays in all aspect of anatomy and forensic medicine. Second thing, I would like to say that Indian Evidence Act is going to change, it's rapidly changing now. Because I remember initially there was no electronic evidence used to be taken as a granted, or it was taken on the cognizance. But nowadays, even an Indian judicial system is taking electronic evidence is one of the evidence in the Indian Evidence Act. So, in a view of that, I think our all medical sciences which deals with evidence for criminal justice system or civil justice system, which will be very important in court of law or any act or rules of this country, or I think in an international arena also. And as a young, I like to say that there is a research is required. You can develop a new diagnostic systems, you develop a new diagnostic criteria, or develop a new methodologies, which will help to achieve a more robust evidences or most methodologies, which will help for not only for the practicing professionals, but also all this academia or the school of medicines, which deals with the forensic medicines or forensic anatomy. It's my very hearty congratulations to our dynamic department, anatomy department, Professor Sham Kishore and his dynamic team. I really appreciate their effort for arranging this international webinar. And as a Nair, we will strive or we will pursue that, we will ultimately deliver more quality programs to you and our also all this medical field. And I vision of that this international webinar, which will give a more, cultivate your more important knowledge, which will help you on or your studies, which will help you in a day-to-day practice, and which will help you for all this research area. Thank you. Dhanyavad. Jai Hind, Jai Mata.
Thank you very much, sir. Now I would request Dr. Yuvraj Bhosle, sir, to felicitate Dean sir with memento and certificate. Thank you, sir. It gives me a great pleasure to introduce our chief guest, Mr. Satish Vagole, sir. Sir is Secretary, Legislation, Law and Judiciary Department, Government of Maharashtra, Mantralaya, Mumbai, and also holding additional charge of Parliamentary Affairs Department, Government of Maharashtra. Sir is LLB, LLM from Pune University. He is mainly dealing with drafting of laws, rules, and notification of Government of Maharashtra. He finalizes all laws, advises to the government on legal issues, handles legal work of all government departments. All laws are published under his signature. He is having 29 years of experience in drafting the laws. He started internship program for law students. Such an eminent person we have as a chief guest today. I would request sir to address the audience.
Good morning to everyone. It is a great pleasure and honor to be here with you inaugurate the international webinar on forensic anatomy and medical laws organized by the Department of Anatomy, Nair Hospital, Mumbai. The dignitaries present today's webinar are Dr. Sudhir Medhekar, Dean, Nair Hospital, Dr. Sham Kishore, Professor and Head Department of Anatomy and Organizing Chairperson, Dr. Yuvraj Bhosle, Organizing Chairperson, Dr. Sumit Sonone, Organizing Secretary, Dr. Dattatreya Dombe, Organizing Secretary, faculty and practicing doctors all over nation, postgraduate and undergraduate students. Today's international webinar on forensic autonomy and medical laws. More than 600 persons are registered. Honestly, I have limited knowledge of medical law science, but I am a student of law. Therefore, while handling criminal cases in courts as an advocate and handling the work in the Law and Judiciary Department of the Government of Maharashtra, I know the importance of forensic report, which are done by the doctors and experts. Forensic plays a crucial role in medical science by applying scientific principles and techniques to investigate and analyze various aspects of legal and criminal cases involving medical and biological evidence. Forensic science contributes to solving crimes through investigative activities such as determining the cause of death, identifying suspects, finding missing persons, and profiling criminals. Forensic analysis of biological evidence such as DNA, blood, hair, and tissue samples can link suspects to crime scenes and victims. This helps law enforcement agency to identify the criminals, solve crimes, and ensure justice is served. Forensic science is a like bridge between medicine and the law. It helps to understand how human body works in the context of solving crimes and legal matters. It is like a puzzle solver in the world of justice. Investigative agencies ascertaining the cause of death, identifying suspects, locating missing persons, and profiling criminals are all part of forensic science role in solving crimes. Forensic pathologists examine deceased individuals to determine the cause and manner of death. Autopsies are used by forensic pathologists to ascertain the cause of death. They examine fluids, tissues from the person during this procedure to determine the cause and manner of death. This information is essential for legal purposes such as criminal investigations and insurance claims. Identifying the cause of death accurately can also provide lights in public health trend and political potential outbreaks. By analyzing evidence collected at the site of crime, such as fibers, hairs, blood, and fingerprints, forensic scientists can identify suspects. These techniques help to punish the culprits and acquit the innocent people. Advancement in technology has significantly enhanced the capabilities of forensic anatomy. From high-resolution imaging techniques to sophisticated DNA analysis, these tools enable forensic anatomists to extract more information from human remains than ever before, leading to more accurate and efficient investigation. The study of medical jurisprudence is required to the legal practitioners, and knowledge of law is necessary for medical practitioners to unveil the true things and put before the court. It is necessary for the medical practitioner to have a knowledge of Indian Penal Code, Indian Evidence Act, Code of Criminal Procedure. These laws are based on criminal justice system. In this webinar, senior doctors, eminent specialists in the field of medical are participating all over the nation. They will contribute their knowledge and experience, which will be helpful for all participants in the webinar. This webinar will give nationwide all autonomists and forensic medicine clinicians an opportunity to gather together and understand the practical application of forensic and anatomical knowledge endowed with clinical implications and evaluation of medico-legal problems. I urge Autonomy Department of Nair College to arrange such webinars and workshops frequently, as it will help to improve and update the knowledge and skill of both medical and legal professionals. Thank you.
Sir, so I would request Dr. Sumit Sonavne sir to please felicitate Rajendra Wagole sir, Satish Wagole sir. So we take this opportunity to felicitate the heads of department who have come for this function. So I'd request our Dean sir to felicitate HOD Anatomy Grant Government Medical College, Dr. Joshi sir. Tulsi plant. Thank you so much, sir. I would also request sir to felicitate Dr. Mehra Boir Madam, HOD, HBT and Cooper Hospital. Our dear Dr. Kishore Kushale sir, Professor and Head Anatomy at GS Medical College. Would also like to felicitate Dr. Praveen Iyer, who has come to us from National Medical Council. Yeah. And Dr. Shilpa Kolle, madam, please. And Dr. Srividya, madam. Thank you so much, sir. We also welcome all the staff from MGM, DY Patil, everywhere who have come here. And with that, I request Dr. Shraddha to please give the vote of thanks.
Good morning, everyone. I would like to take this opportunity to express my gratitude to each and everyone who has contributed to the success of this webinar. First and foremost, on behalf of Department of Anatomy, I would like to thank our patron, our Dean, Dr. Medikar sir, for giving us opportunity and inspiration to conduct this webinar. Thank you very much, sir. I also like to thank our chief guest, Dr. Satish Wagwe sir, Secretary, Law and Judiciary Department, Government of Maharashtra, Mantralaya, Mumbai. Also additional in charge of Parliamentary Affairs, Department of Department, Government of Maharashtra, for accepting our invitation and for being here with us today. Thank you very much, sir. My sincere thanks to all the speakers, all this morning session chairperson, speakers, as well as the afternoon session chairperson and speakers who has graced this webinar by his physical presence and shared their knowledge with us. Last but not the least, I thank all the delegate participants without whom the success of this webinar would not have been possible. Thank you all for the overwhelming response. Thank you very much. जोशी सर को अपनी सर्टिफिकेट उनको देने और सारा दिन हो जाएगा।
नेक्स्ट सेशन स्टार्ट मैं भी बोलने वाली हूँ, तुम कर देंगे। Rajesh Dev. Dr. Ravindra Devkar sir, Dr. Ravindra Devkar sir, online. He's joining us. May I have your attention, please? We are beginning with our next session. Over to you, Dr. Ravindra. Our next session is Forensic Anatomy of Organs. The chairperson for this session is Dr. Ravindra Devkar sir. Dr. Ravindra Devkar sir is additional professor in Department of Forensic Medicine and Toxicology at SAID GSMC and KEM Hospital, Mumbai. Dr. Devkar sir is joining us online. Welcome, sir. Our speaker for this session is
Thank you.
Dr. Rajesh Dere sir. I request Dr. Shada ma'am to welcome sir with a tulsi plant. Which is already. Yes. Yes. Okay. Before starting with the next session, I would like to call upon Dr. Datta sir to felicitate Dr. Joshi sir with a certificate. Sir, excuse me.
Okay. Anything more? Only one thing I want to tell about it. One point. Hello. Thank you very much. Now, just one point which I would like to elaborate here in relation with that of the facial reconstruction, what Dr. Vapresa was asking. And 2020 January, forensic odontology, there was one workshop was conducted there, and in which they have given the details about the facial construction, for which you have provided about 10 skulls to them. An actual picture of the person can be constructed with the help of certain other points are there, for which the detailed discussion will require. But we can go for the facial reconstruction on the dry skull whenever we are receiving it from the police departments. Thank you very much.
Thank you so much, sir. Yes, sir. So fine. So please.
Good afternoon, all. Just this topic. We'll just put an insight in this. As for so many years, to look here.
Yes.
Yeah. We are doing continuously superimposition also. I have full-time forensic odontology post in Department of Forensic Medicine, LTMMC Science, for so many years. And as of now, we have Dr. Swati with me. She is postgraduate in forensic odontology and anthropology from National Forensic Science Laboratory, Gujarat. In last 3 months only, we have done 3 superimposition and we got 100% result for that. Regarding, along with this, what we have done reconstruction also. The data, she can elaborate in a better way, but I can just brief this audience. See, there are regional data available in good journals of various states in which the thickness of the skin, musculoskeletal, when we require to reconstruct a face. See, superimposition is something different and reconstruction is different. I'll just give an insight. First conduction of facial reconstruction proper was done at LTMMC only during mine blast in 2006. You can just Google on that. There were 25 casualties during the train blast at Mahim. And 25th, there was no body, only disfigured and you can say somewhat mutilated because of trauma or blast. A skull was available. We preserved it for nearly 10 to 11 days under various security because investigating agencies also suspected that the Mahim blast was carried out by a suicidal bomber, but could not get a clue. So for 11 days, we formed a team, including anatomist, forensic medicine, plastic surgeon, dentalo-maxillary surgeon, and a good surgeon also. 5 members, we worked for 3 days, and we reconstructed that mutilated face. So there are various ways of facial reconstruction also. You can do from a dry skull also, and you can do from a mutilated skull with mandible. Whenever I speak skull, it is always with a mandible. Devoid of mandible, we can't do anything, or our results may not be that appropriate. So we are doing this regularly, and to be very frank, this branch, say forensic odontology or bone examination, is still a dormant branch in Maharashtra. You know, it is better way in Gujarat because of National Forensic Science Laboratory, or it is good in Punjab, Chandigarh, where the Central Forensic Science Laboratories are doing a good job in this field. But a sad part to Forensic Science Laboratory of Mumbai or Maharashtra is that they don't have an anthropologist in this and they don't do such activities. So medical colleges should form some coordinating committees, including all the stakeholders. It is not a single department work. All stakeholders has to form in Mumbai. See, Mumbai is, you know, जैसे बोलते हैं हटके metropolis है. You know, Mumbai budget of corporation is better than 16 state budgets of this country. So nothing is impossible in corporation, but the willpower of the authorities and the work culture of the faculties has to be improved. What happens, आपण काय करतो? Even though we send to anatomy, not maybe science, any department, not to specify, they will say आमचं काम नाही. And then, you know, government, आता गेले secretary, त्यावेळेस बोलायला हवं होतं की आहेत का सर की GR काढताना इवन फॉर कस्टोडियल डेथ्स ने फक्त गव्हर्नमेंट कॉलेजच नाव येतात. बीएमसी काय गव्हर्नमेंट नाहीये का? मी कितीतरी वेळेस सीएम ना बोललो, whenever I got opportunity in COVID also, when I used to directly interact with the bosses of the state, I don't know why BMC government medical colleges do not consider it as a public institution. We are also a public institution. All I used to tell in my medical teacher association meetings also, ज्यांनी attend केले असेल, कि we are also public servant if you are permanent, which is defined by law. But you see the GR of all the government, they will never consider we have better medical college than many government college of this state. पण ते कधीच कन्सिडर होत नाही. त्यामुळं काय झालेलं आहे, ह्या बाबींमध्ये शासनाने एक व्हॉट आय विल से मोनोपॉली तयार केलेली की जर तुम्ही जेजेला असाल एचओडी तर ह्या गोष्टी करू शकता, पण सायन्सचा फोरेन्सिक एचओडी किंवा केएमचा हा त्यांना कॉम्पिटंटच वाटत नाही. आय डोंट नो मीन्स व्हॉट क्रायटेरिया गव्हर्नमेंट जेव्हा ही टीम फॉर्म मागे जेव्हा कस्टोडियल डेट हे धुळा वगैरे नवीन मेडिकल कॉलेज जिथे माझे स्टुडंट एचओडी दे आर केपेबल ऑफ डुईंग कस्टोडियल, बट आम्ही जे एवढे वर्ष इथे काय मराठीत म्हणतो ना, आपण घासली फोरेन्सिक मध्ये, सॉरी, टेक इट इन ए पॉझिटिव्ह वे, वी आर नॉट केपेबल देन. आणि मी किती 6 कस्टडियल डेथ सायनला केलेत हायकोर्टच्या ऑर्डरने. सो देअर हॅज टू बी अ रिफॉर्मेशन. पीपल आर रेडी टू डू. डोंट फील बॅड. हे मी सर्वांपुढे बोलतो. ते तुमचे डीन आले तरी बोलेल मॅडम, किंवा सेक्रेटरी असेल तरी बोलेल. इट्स अ फॅक्ट ऑफ द मॅटर. कारण महानगरपालिकेच्या मेडिकल कॉलेज इज ऑल्सो अ पब्लिक इन्स्टिट्यूशन. वी वर्क फॉर पब्लिक. आम्ही कुठे प्रायव्हेट कामं करतोय. अँड वी डू ऑल मेडिको लिगल ऍक्टिव्हिटीज एक्सेप्ट फ्यू. का तर शासनाचा जी आर नाही. मी तुम्हाला सांगतो सर, असं काही नाही. मी स्वतः 12 एन्काउंटर डेथ केले. तुम्ही जस्ट गुगल सर्च करा, हायकोर्टच्या सांगण्यावर केलेलं आहे. इफ यू आर नॉट कॉम्पिटंट, हायकोर्टने ऍडमिट नसते. अँड लॉज हॅव चेंज नाव. असं काही राहिलेलं नाही. इफ यू आर एक्सपर्ट, इंडियन एव्हिडन्स ऍक्ट हॅज चेंज. यू कॅन एक्सरसाइज युअर ऍडवाइस. सेम एक्झाम्पल, सिल्क मिल्क केस, जी रेप केस झालती, त्याचं एक्झामिनेशन विक्टिमचं कोणी केलं? कॉर्पोरेट हॉस्पिटल. That case report is admitted by Honorable High Court and Session Court during trial. Now, as per Indian Evidence Act, you are a RMP, and if you are specialized, having a specialized skill in that subject, you can advise on that subject. This is so simple law says. We only demarcate. हे यांची कामं आहेत, ही यांची कामं. So thank you. I need, sir, तुम्ही पुढाकार घ्या या गोष्टीत. तुम्ही जे म्हणजे HOD आहात, हे सगळे HOD जे महानगरपालिकेचे अनाटॉमीचे, दे ऑल्सो हॅव दॅट रिक्विजिट सील. जर ते GR मध्ये किंवा ऍडिशनल सर्क्युलर काढले तर नक्कीच आय एम होपफुल की आमचे 4ही मेडिकल कॉलेजचे HOD फोरेन्सिक असो, HOD अनाटॉमी, दे विल कॉन्ट्रीब्युट इन ए गुड वे. थँक्यू.
So really, it's a good thing that the sir is asking to include their names in the government GR. Actually, it's really a very good thing that I'm very happy to take all these medical colleges in relation with the examination of the skeletal remains. But for that purpose, whatever the protocol and other procedure is that we have to follow. As you rightly said that you have done 10 to 12 cases and the High Court judge has taken into consideration. So I think we can give this in our application saying that you have done so many things, and when the special orders are given and when you are doing this work and giving our opinion, why not to go in the routine examination of this odontology, forensic odontology examination, at the same time anatomy also, because the load will also is going to get decreased on us, because so many districts which are included under the Grand Medical College and other medical, only few medical colleges, as I told you, 5 to 6, they are doing this work of all the districts in the Maharashtra. So there will be the good distribution will be there, workload will also get, and they will also get the opportunity to examine the skeletal remains is one of the important work by which we can help to the department. Accordingly, I will also try for this and I will put the word for it. Thank you.
So I would like to introduce Dr. Rajesh Dere sir, who's the speaker for our next session. Dr. Rajesh Dere sir is head of Department of Forensic Medicine and Toxicology at LTMMC Sion Hospital, Mumbai. Sir is also Dean of BKC Jumbo COVID Center and BKC COVID Vaccination Center. Dr. Rajesh sir has been awarded Mahatma Gandhi Samman for contribution in COVID-19 pandemic by NRI Welfare Society of India, conducted at Global India Summit in prestigious House of Commons, London. Sir has conducted approximately 20,000 medico-legal post-mortem and around 1,600 cases of victims and accused of sexual assault, including POSCO cases till date. Dr. Rajesh Dere sir was appointed as medico-legal expert by the government of Maharashtra in Taj terror style. Dr. Rajesh Dere sir was forensic expert who led forensic investigation and played a major role in identification of deceased as a known terrorist in Mahim blast case. Sir is having a vast experience of dealing with medical legal cases. I request Sir to give a talk on forensic anatomy of organs.
So good afternoon or good morning. We are midway now. We are near to 12 o'clock. So good noon for you all. So the topic basically which we will be dealing, tight nahi karte hain. So tight.
ऑनलाइन में नहीं आ रही ऑनलाइन में नहीं आ रहा वो स्लाइड शो नहीं आ रहा
So the topic for today's presentation is forensic anatomy of the organs. Means how the organs study various organs of our body, including skin also. Skin is one of the organ also. How we can utilize the anatomical knowledge of the organs for medical legal investigation, what we do in a routine course to determine various crimes, cases, or providing a lead to the investigating officer in all such cases. One such, what we have discussed in morning sessions by Dr. Shailesh Mohite sir, Dean of Cooper Medical College, and also Dr. Sumed regarding examination of skeletal remain. We'll carry that forward. I will just read out. I would be interested more on discussing the forensic anatomy related to organs only, rather than this. Is just simple. If I say forensic medicine, is application of knowledge of law in medicine. Same forensic anatomy is application of knowledge of anatomy in the medical legal science. So these all basically in developed countries, there are no forensic medicine expert. They are called as forensic pathologists. While in our country, there is no such concept of forensic pathologist. But surely we have all these allied benches, forensic anthropology. We have soil forensic examiners now. In this crush, various aeroplane crushes and all this, they can, we have forensic soil experts nowadays. Just 2 minutes. मी घेतो. काय So thank you, Dr. Yuvraj. Dr. Yuvraj is a man of spirituality. And he is just like my brother only. So we have very good relations for years together, and we'll continue with the same. Now, just I will overview what are the major organ systems. Is the CVS, nervous system, digestive, endocrine, muscular. We all know this. We'll not discuss more on this. Now, what we are more concerned of today's topic is what is the importance of understanding the organ system in forensic investigation. or in medical legal investigation. Better than forensic investigation, we can have an umbrella word like medical legal, which encompasses everything related to the organ, related to the medical legal cases. Now, first and foremost, when we conduct a medical legal autopsy, see, there are two autopsies. One is a pathological autopsy, other one is a medical legal autopsy. Pathological autopsies basically do not conduct any medical legal case. They are only purely to know the cause of death, which is either to be a natural one only. But in medical legal cases, other than natural cases are examined. Now, in that, when we receive any Panchanama or requisition of police, they are more interested to know the cause of death and the manner of death mainly. Then you can have identification and various other criteria. Now, in determining the cause of death, knowledge of these organs for a forensic pathologist means the forensic people, identifies the cause of death depending on the condition of the organs. We can give many examples. Take, we open the lungs, we get cavitation, commonly in this country. We are still a developing nation. So that examination of that organ, when we see that there are cavitation of lung, there is pericardial effusion, or there is pericardial thickening, this examination, this is anatomical examination, will surely click in my mind as a forensic pathologist. Yes, this can be a case of tuberculosis. So this is where, the examination of the anatomy of each and every organ is crucial for determining the cause of death. You can take many examples. You can take ERDS, you can take intrapulmonary hemorrhages. Second is identification of the trauma. Now, different organs characterize response to trauma injury. Understanding this response aids in determining the nature and extent of injury sustained by the victim, providing valuable insights in this. I'll give a better example. I'll not name that high-profile case, which I did 10, 12 years before. There was a lung injury because of some unnatural act or manner. Liver injury. And the contention of the court was that whether the case was brought dead, means before death, or it is declared on death. What is declared on death means when that victim or the patient is received in the casualty, being the entry point of every hospital, we do primary local examination. Say we have 4 process, palpation, percussion. This is what basics we do. Now we are not interested. If the patient is so bad, we should directly do ECG and start is our confirmation. Now, in that case, there was a diversity from the defense law. Defense means jo aaropi chastat. So, defense counsel, they argued the case was brought dead. The hospital said that it was declared on death as per the notings. Every noting is done in casualty or the treating doctor department. So, in that, blood flow of the liver, I know what was the blood flow, how much is the injury. And there is one good book in physiology, which I referred, that time Ganon's. That was a very higher book, but now we used to read because of court matters. And that blood flow and type of injury on the liver and the dimension of injury on that liver. After that, he proved that it was a broad death case. And court agreed to this. See why I'm telling you this, how important is an organ examination. Sometimes we all know in primary health centers, I was also a medical officer, 90% of doctors do not go in PM room also. This is said, may or may not be correct. We are the best judges for that. So examination of organs is very vital for any medical legal examination. Otherwise, it's just, we are increasing cases of keeping histopathology, tissues, CAs, and overburdening of all these departments are done unnecessarily when it is not required. Now, interpretation of the toxicological findings also means there are some poisons. Take some example of substance of abuse also, which have typical features seen on the organs. By that, we can easily link this can be the poison. I'll give a basic example, which is not so predominant in this country, is the mercury poison. There is some condition called as mercuria lentis. Means the lens is again, eye is also organ. So if we are talking organ in general, it is not only the big organs in weight and size. So if I examine that eye, if I do a proper organ examination, and if I see this whitish flecks in the lens, which is supposed to be a type of mercurial lentis, I can easily opine that yes, this can be a case of mercury poisoning. So, this is where we say in ICUs also, 2 years before when Dr. Sandhya Kamath was our Dean and Director, we started this coordination examination in MIC. If there is an LASD, so that importance now, coordinated approach is very important for tertiary unit. Otherwise, we'll miss out findings and unnecessarily we are burdening our system. Fourth would be evaluation of the postmortem changes. Now see, we are always asked as a forensic expert by the investigating agency to give what is the time of the death. If that body is brought dead, they don't know what is the time of the death. There is no last scene theory. There is no one who can witness ki आखिरी बार मैंने कब देखा, शेवटी कौन बोला. There are no phone records, CDR records in which it is seen that last this person has talked with someone. So they usually put up to us that what can be the time of death. So this organ examination in rigor mortis, say in decomposition, say partly liquefied liver or pulpy lungs. So this organ examination, from this also, we can determine time of death, not only PM lividity on this. Best example, we have a dictum which says that the first sign of decomposition, we are talking with macroscopic, not microscopic eye vision or macroscopic. The first sign of decomposition in any body would be the discoloration underneath the liver. Is the lower part of the liver where the gallbladder is attached and a transverse colon is in constant touch with the undersurface of the liver. We say that this would be the first sign of decomposition of body. That means organ, if you have good examination, we don't see. तुम्ही बघितले कधी फोरेन्सिक वाल्यांना लिव्हरच्या खाली बघताना? Rarely. We miss out all these things. So for time of death also, if you do proper organ examination, we can have a better margin. Undoubtedly, I never vouch that time since death, after death, we can give precisely ki 10 वाजताच नाही. But at least we can give a good range to the investigating officer so that in that time range, he can converge his investigation on that loophole only. He is not a god. Always keep this in mind. Police is never a god. He is also a human being like us. And there is the role of this forensic or the medical evidence where to help. Fifth one is identification of body fluids, various body fluids. One of that we can say, as Dr. Sumed has said, amino acids. We can take many body fluids examination, say CSF examination for meningitis. Now, this is one good thing I think I should discuss. Support for organ donation decisions. You have this Human Organ Transplantation Act, HOTA, which was in 1995, now revised in 2000, Organ Donation Acts. So there also to decide a brain death, you need to have organ study of the brain proper. So what all, I'm just saying where the organ examination of being the anatomical knowledge of organs will help in medical legal investigation or the legal processes of this country. Now this is basic anatomy just for projection. I will not discuss because I am not anatomist. Now see, how do I identify organ weighing, anatomical knowledge, experience? This has been dealt with. Now use of gross examination, histology, and this is one good thing. Even though we examine that organ with our naked eyes, many times it's very difficult to say based on that finding that we can derive to a logical conclusion of giving cause of death. So what we do, we further examine that organ for histopathological microscopic examination. In medical colleges, we have some electron microscope in KM also, I think. We have done, I was 1.5 years in KM as a professor. So this way, organs examination, even the internal microscopic, can also give a very good diagnosis, which can lead the investigation. Now, this is what is the role now? We always feel why we should examine the organ and what is the medical legal concern of any anatomist and where is our role basically. One of that was skeletal remains, as my topic is only organ examination. That is one of the major which has been already discussed. So in this, first is our understanding tissue and organ damage. One example already I have given to you. So from tissue damages also, we can determine cause of death, manner of death. From tissue damage, I found a laceration over liver. Based on that type of laceration, even though there is no history given by police to me, I can opine whether it was a trauma by accident, whether this injury is caused by, say, assault, or these injuries are suicidal in nature. So this is where understanding identification of fatal trauma. Again, same. Now, underlying medical conditions. If you have good examination skill of organs, I would vouch whatever we are sending for histopathological examination, which is not required, and we are burdening the pathology department, 30% cases, if I examine my organs properly, I can give cause of death. If there is no suspicion, if there is no unnatural element in that. At SciEN, I have a data, huge data. We do around 4,000 PM per annum. So daily average is 10 to 12. And in that, we have kept 100 histopathological sample in a month. And when we get that receipt of that report, 90% turn out to be natural. It means in 90% cases, the death was natural only. And if the death is supposed to be natural, why there is need of PM? See, this is still going in discussion in Supreme Court now. I had a discussion with Chandigarh, head of the department, few days before. If you take data of all the PM centers, I can vouch 70% unnecessary PM is done by us, just because we do not examine it properly and we overburden the pathology department. So that is the reason I think the pathologist is not there. 2 years before, government formed a committee. I was a part of that. All the organs were sent to JJ pathology department. Now we went in the Human Rights Commission, went to secretary. Now see, for last 2 years, all the police station in and around Mumbai division, which was 90% catered by pathology department JJ, now it is distributed to all the medical college in the even way. So this is where we have to work. Now, detecting underlying medical condition, examination of organ can reveal underlying medical condition that may contribute directly or indirectly to the cause of death. Identifying diseases such as heart disease, cancer, this we can easily identify. We can easily identify ischemic heart diseases if you properly examine the myocardium and the endocardium or the coronaries. Only the fresh MI cannot be detected macroscopically with your naked eye. काही forensic वाले लिहून टाकतात, that is a different thing. त्यांना देवानी शक्ती दिलेली आहे, they can do anything. but actually a fresh MI cannot be detected on organ examination. Yes, if it is more than 16 to 24 hours, some changes on the organs like paleness of the myocardium can be appreciated and commented. So examination can lead to cause of death of any organs. Now, evaluation of toxicological findings. Forensic anatomy helps correlate toxicological findings, physiological changes in organs and tissues. Understanding how drugs or toxin affect organ function is essential for determining role in cause of death. See, now this substance abuse, at least in the metropolis, designer drugs, 6, 7, I think 1 year before, we had an international symposium on. I'm very fond, and this one of my liked topic is designer drug, synthetic drug for so many years. I've done a lot of work on that. And one of our good officer, Mr. Samir Wankede, delivered a lecture at Science, along with all the other councils in this. See, nowadays, this is a menace or social taboo to young generation. आपण सगळे वाचतोच ना पेपरला की पानाच्या टपरीवर पण म्याव म्याव भेटते or MD भेटते. It's a fact. There is nothing wrong in this. This is what is going in these countries. Now these cases are increasing by leaps and bounds. And if you don't examine the liver properly or the lungs properly or the organs properly, we will again miss out. And the second worst part is that even though I send this sample for chemical analysis in forensic science laboratory, they are only limited to 40 poisons. एवढीच आमची तपासणीची कॅपॅसिटी आहे, याच्यावर आमची मशीन बघू शकत नाही. So see how it is easy if you don't examine your organ properly, if you don't examine things, to conceal crime in this country. So documentation for legal purpose, detailed documentation of organ findings serves as an evidence in legal proceeding, aiding in determination of cause and manner of death. See, this one prime notings is organ donation under Human Organ Transplantation Act. The procedure is that they remove the organ after due procedure is done. Then that body is sent for PM to the forensic medicine department. Now, if they do not record organ finding properly, because kidney is already being removed from a donor to and has been planted in the recipient. So this documentation of organ, again, for each and every organ is very, very important to determine the cause and manner of death. Forensic anatomist may provide expert testimony based on their findings to support investigative and judicial process. But असं काही नाही आहे ना, we always, when we examine so many sexual offense cases, even case where you do skeletal examination, anatomy with forensic, and the anatomy people will always say, ये forensic का ही काम है कि उधर जाके evidence देने. This is not a matter. See, if you go by a law, Indian Evidence Act, you have to just read 45E. One act related to expert evidence. 1.5 page, everything would be clear. It is not only forensic has to go, any expert, maybe anatomy, pathology, who has examined and signed that document is an equivalent expert as per forensic expert. So court doesn't say, अरे forensic expert का ही हम ज़्यादा सुनेंगे and a forensic anatomist का हमें record on evidence आधा ही लेंगे. There is no such law. So this is our perception. These are old protocols going for years together, but law has changed. Now this time also, the IPCs are changed to Sanitas and all this. There are few amendments in previous laws also. So laws are changing. Various court orders, Supreme Court, every week we get a new order on same subject. Take negligence. From Jacob Matthews till now, 10 new orders from Supreme Court. So that way, forensic anatomies should now play a major role in medical legal investigation where their expertise is necessary. Now, contributing to public health also, what way we can do? Insight gained from forensic anatomy contribute to public health effort by identifying trends in cause of death. We can identify trends in cause of death and guiding preventive measures. See, PSM department completely works on the data provided. See, preventive measure. Any preventive measure, if any new policy, maybe a state policy or a national policy is to be made, they have to have data. Otherwise, वो secretary कोई god नहीं है कि रात को उसके सपने में आए और सुबह policy बन गई. So we need a data, and forensic organ anatomy examination data can also play a major role. See, means anatomy people may feel, in preclinical, you always feel, आमचं एवढंच काम आहे, dissection करायचं, शिकवायचं. असं नाही राहिलं. Now, every pre and paraclinical substance should widen their scope now. जग मोकळं आहे आता. What we say? We have to widen our scope. असं बघायचं नाही आता. We have to widen our scope and we have to do hard work. We have to make up our mind. We have to do more work and we have to upgrade our department and the subject. What we forensic at science for last 22 years I was done. So forensic anatomists can also guide in preventive measures, understanding the epidemiology of fatal injuries. Again, this, all fatal injuries, an anatomist can examine and make a good paper. Why not? My 2 years PG student, when I was in BKC, I had all AI robots, and you might have seen Janna Maite, or you can go on the Google. We are first in India to start AI-based robots to distribute food material in the wards. So now you can also examine as a forensic anatomist various organs, make a proper protocol, dimensions, type of injuries and all this, and we can guide to government. See, this is what the pattern is going on for so many years, and preventive measures are ineffective. So you change it from this to this. See, when we do thesis for PG, शेवटच्या पानावर we have suggestion and conclusion. We always write to government, or just like that no one reads is a different thing. We just keep it in cupboards, HOD like copy देतो, university like copy का आपला thesis झाला. But see, what I mean to understand from all this is, for an anatomist has a major role. This is my significance of discussing all these stakeholders. Now, and diseases help prioritize resources for intervention and public health campaign. Now, advancing medical knowledge and training. Forensic anatomical findings contribute to medical research by providing insight into pathophysiology of injuries and diseases. See, when you know pathophysiology of injuries and disease, when you examine the organ, after that only I can comment on. Second is training programs in forensic anatomy help educate future healthcare professionals and forensic specialists like us, enhancing their ability to accurately assess the cause of death. So this symposium now what you are taking is a part of this only. Training programs has to be increased. I think for so many years, this is, I think we should congratulate this Department of Anatomy of Nair Hospital that such a skeletal examination, medical legal orientation symposium, for so many years it was not taken in, I would say in Mumbai itself. I didn't had any knowledge. And this is where now anatomy department, every department in Mumbai should take a lead and have such symposium training program, so that training even the forensic medicine people also, just like examination of skeletal remain is a domain of anatomist. That also, if you train us properly, that will also help us in when we do PM of skeletal remains. We get few bodies, rare bodies, in which we get a skeleton we just 1.5 months before we got from Biondi. So training programs, which is lacking in this state, I would say in this Mumbai city also, every department and the anatomy department should now take a forefront in training the forensic specialist regarding the skeletal remain, how to examine the organs, along with the pathology department if possible. Now, organ examination, I'll only cite 1 or 2 examples. In homicide investigation, There are many case studies showing how examination of organ injuries helped establish the cause and manner of death. We have already discussed one or two examples of this. Take a stab injury over a lung or a liver or a kidney. From that, we can easily give manner of death. Yes, it is a stab injury. If it is a stab injury, it has to be a homicidal death. Simple. Then drug-related deaths. We have discussed one common, cause of death which can determine from organ examination is alcohol-related deaths, cirrhosis of liver. We can easily examine. It may be a macronodular or a micronodular is a different thing. But if I examine a liver, if I get a cirrhotic liver, if I get a nodules, I can easily come to a conclusion it is alcoholic liver disease or the cause of death is related to alcohol consumption. This is the commonest what we are doing. Then detection of drug toxicity in organs such as liver. This we already discussed by one example. Child abuse cases. Examination of organ injuries revealed sign of child abuse or neglect. Identification of pattern of injury in multiple organs contributed to the prosecution of perpetrators and protection of vulnerable individuals. This case we have done, you Google, 12 years before, I think Sion Hospital or our department was one of the first in this country to give cause of death as a battered baby syndrome. Battered baby syndrome is very difficult to give starvation and all such cause of death because it has repercussion till the center. So multiple inquiries, in that when we open the skull of that child, see what is a battered baby means, you all know. See, these parents, usually unwanted children's or stray children's, orphans, they always inflict minor injuries over multiple period of time, and including malnutrition, they are not fed properly also. So in that cases, what happens? Multiple injuries at various time. Sometimes the knuckles are used on this what we hit on the knuckles, these knuckles. Now, if he is a child, means less than 12 years for medical reason, and for legal reasons, under POXO Act is 18 years. For medical, we say 12 years is the differentiation between a pediatric ward and a adult ward. But now, after the POXO Act, legally, child is less than 18 years and more than 18 years is an adult for legal sense. So in this, hitting with the knuckle is one of the common procedures. If we do that in battered baby cases, once we open the skull, we got minor contusion of varying ages. Age of injury. So such detailed examination, we could easily say yes, it is a case of battery. There were other findings also along with this. But organ, we confirm from this, yes, minor contusion over the cerebrum of varying ages, and the child is malnourished, then emaciated from one of the Boston schools or age government लहान मुलांचे orphan schools, just like in Mankur, Kalyan, all this we have government sponsored. In that, such many cases are brought to the notice of the investigating agencies. Now, accidental death, organ examination, same, trauma to any organ, laceration. What I can say, if it is a lacerated organ and a opinion is asked from me by the investigating officer, this is a common see. This IO is interested in only 5 to 6 things. What is the cause of death? What is the manner of death? If the injuries are present, what are the type of injuries? If you say there are injuries present, what is the weapon inflicting that injuries? Basically, they want this one. 99% if you go through the queries raised to the forensic person. So in that, accidental death we can easily determine. Depending on, say, if there is CLW on organ, if I am asked what is the type of the weapon inflicting this, I would opine on this, if I examine the organ properly, that the type of weapon or the substance used is hard and blunt. So hard and blunt can be by accidental trauma, hard and blunt can be faced, hard and blunt can be by a bamboo stick, or any such impact given to that. Now, missing person investigation, again, just like identification of age, sex, which has been discussed by Dr. Sumit, we would only add in this. Now, DNA analysis, DNA is such a boon for identification to the human beings. Said we do unclaimed body 1 or 2 every day at SIAN. So every case we keep our DNA profile. We send it to FSL. So maybe after 1 year or 2 years, if somebody says from the photograph from the website of the police, he can be my relative or I know that person, we have to just take a blood of the, blood relatives of that deceased and just compare with the available DNA. This procedure was not available before. We used to only note down all the findings. And from that, it was very difficult. After 2 years, somebody comes to me, कि आपके यहाँ पे PM हो चुकी है, and ये हमको लग रहा है ऐसा है, and give opinion that yes, this is the correct identification. It was very difficult, but DNA analysis now has facilitated all this positive identification. See, this is one of the photo we have just seen, how the accidental trauma of the organ can happen. So there are few complex cases also in which organ examination, one of that I have discussed, which I have not named in the previous talk, means 15 minutes before, that some critical cases, if that PM surgeon has done proper organ examination and proper noting is done, we can give a better insight in that. So thank you for this. I just, I thought within 40 minutes I should complete my schedule. So my conclusion after this session would be that forensic anatomists or the anatomy people should now come forward, should be in touch with the Department of Anatomy on regular basis. PMs are done, skeletal bodies are examined. And one more thing I would tell you, even though your medical college name is not in that JR or whatever is there, if the investigating officer feels you are expert in this, if he gives you if he asks you for examination, give your opinion, please don't reply, "Hamara kaam nahi hai." Give your opinion to the best of your ability and leave it to the courts to verify your opinion. Let courts say your opinion is not good, your opinion is not appropriate, and let court say you are not expert in this field, which court will never say when we are expert in this. So fear of the law has to be removed. This is, I always tell in science, whenever I discuss with clinicians, fear of law, you are doing more medical legal cases. So thank you very much. Thank you, Department of Anatomy, head of the department, my friend, brotherly friend, Dr. Yuvraj, for providing me an opportunity to be interacting with you all. Hope this insight will make some changes as a forensic anatomist to all the Department of Anatomy and जे काही private चे आलेले anatomy department. In Karnataka, have you gone in Karnataka? Private medical colleges are doing it. मग त्यांच्यासाठी काही वेगळा लॉ नाही ना देशातला. Same CRPC, I am reading, you are reading, Karnataka is reading, Delhi is reading. See, fear of law काढून टाकला ना. And secondly, work attitude has to be improved. What we do, जाऊ दे आपलं काम का वाढवायचं म्हणून करायचंच नाही. हे पण थोडं सोडून दिलं ना. Really, I will tell you, if you do our coordinated work, just like government started after Nirbhaya case, one-stop center, government started after Nirbhaya. And we are first in India in 2018 March, we started one-stop center. Coordinated approach is yielding a good result. So here also, maybe organ examination, skeletal examination, wherever anatomy expertise role is needed, please help out with the Department of Forensic Medicine. And both the department can do really a good work. One of the good work, I think, Shinabora bones examination done. See, we can do good work. Only we have to coordinate properly, and we should have that good work culture and a determination to do good work. Thank you very much.
Wonderful session by Dr. Rajesh Dere sir, who is having a vast experience. He has already conducted more than 20,000 autopsies and given his expertise in different complex cases. Sir explained us regarding the importance of understanding organs, their anatomy, helpful for forensic investigations. Besides this, importance of anatomy and its role in medical legal investigation under different heading, which helpful for understanding tissues, identification of fetal trauma, underlying medical conditions, evaluation of toxicological findings. Sir also explained the interdisciplinary approach and as per NMC CBME curriculum, as there is a need of integrated teaching and hence there should be a collaborative team approach towards medical legal investigation and appropriate help and aid in administration of law. So it's our combined responsibility to help and aid in administration of justice. Sir rightly inform in detail the role of detailed anatomy, the knowledge of all anatomy of organs, their pathology, and how it helpful for further giving cause of death and helping investigation. So thank you, sir. Wonderful talk. And also I am thankful to the organizing team who called me, given this opportunity. So I thank to our respected Dean, Dr. Medekar sir. Thank to our organizing chairperson, Dr. Shyam Kishore sir, my respected teacher, dynamic teacher, Dr. Yuvraj sir, and my colleague, Dr. Sumed, and his whole team. So thanks for organizing team, having such a wonderful webinar, which certainly helpful to all. And certainly from this, there will be a development of collaborative approach of forensic medicine and anatomy experts towards aiding investigation and court of law. Thank you.
Thank you so much, Dr. Devgan. No, but he was busy because MVH's some work was there. So I would request Dr. Sumek Sonane to felicitate our today's speaker. Sir, इकडे द्या ना. इथं या. म्हणजे सगळ्यांना दिसतं सोडून. That's it. With a memento and certificate. Thank you so much. Dr. Rajesh Dere was Dean of the BKC facility. Clap please for not only for his one session. I was myself, I was at Sion Hospital with him, and that time he became Dean of the BKC facility. And the kind of work Dr. Dere has done in COVID, he was running the topmost COVID facility center. Lata Mangeshkar herself, she wrote a letter to him that you are doing good work. So, and I was so fortunate to be his colleague at Mumbai University learning hospital administration. Of course, I never got into administration after that. But Dr. Dere, he was the only person from our batch who made it and made all of us proud, our batchmates proud. All of us only, keep on telling that Dr. Dere, our batchmate, has become the dean. Thank you so much, sir.
Yeah. Yes, sir.
9 to 4 they are there. That is not right. MCI, MUHS and our BMC, the burdens are there. The burdens है. Now again MCI ने NMC ने नया norms निकाला है अभी. How to enter your all the how many lectures you take and all. In that we won't get time. And second thing, anatomists, they say if you do law, you will get wide scope in anatomy, forensic anatomy. Explain this.
See, first of all, undoubtedly NMC guidelines, MHS guidelines, we all have to follow because we are we are medical teachers. And this is along with medical teaching, we have to do the job. Now workload is everywhere. You go to any private institute, sorry, I will recheck my words, to any public institute, maybe corporation or government, everywhere, if you compare the workload, manpower required would be less. So that should not be a hindrance. See, I can give my example. For 2 years, only Dr. Sawadekar sir and myself were in department. No, that time, you know, when we got in BMC forensic wale milte hi nahi. Still same work, we have improved our work. See, somewhere, you know, in COVID, when I got all these accolades and all magazine, Indian Express has given a tagline for me in which I have said, you need more efforts to do good work. So if we have to come out of this 8 to 5 mentality, see, undoubtedly what the SAP and all this bothers me also. And it bothers everyone. And it has to bother because till last year, you know, we used to punch, but we're not so much accountable like the clerks and all this. But for last 2 months, you know, I am HOD, I am facing A&M every month. And I know that this money will not be reverted back or it may take years together. I have to go to head office every now and then. And hata zodat basle or betla ta betla. But that should not be hindrance for good work. See, my means to say, you say, what you depicted is fact for every college. Maybe koni jasta kaam karte, koni kami karte. That is there. Because your workload depends on your drain. Just like Sion is the only medical college which is connected to highway. So we have more police station attached as compared to Nair, JJ, KEM and all this. But that government has decided we have to do work. So you need to put more efforts. And secondly, undoubtedly in this scenario, our establishment, MCGM establishment, now should come up with a helping hand to all this department. We all should have a data operator. I will tell you, when I managed BKC, and not only BKC, I was chief coordinator for all 9 jumbos. Every ward, when I used to manage one ward by separately, 12th passes came for supervision on the patient. So now this, what you said, entries, we have to make because it is NMC guideline. That is our competent authority. If you don't make your entries, your college will get a show cause notice or explanation. So, but in that also, I always feel in my life, I always have my intuitions clear. Everything has a solution, we have to search for a solution. There is nothing in this world which do not have a solution. So it has. If you are head of the department, just like आजही माझ्याकडे 4च फॅकल्टी आहेत. वर्कलोड वाढलाय. फॉक्सोचे डेली 4 केस, 2 accused, 8 ते 10, 12 PM. Still, what we do, the administrator has to plan your department in such a way. See, this is what is called as planning and administration of your department. How to minimize work of senior faculty, what work to be allotted to house officers if you are given, resident, how to divide your, work of your department. Because every department will have a different logistic. Department of Anatomy of St. G.S. yours may not be similar with the Department of Anatomy of Nair. So every head of the department with their team has to devise a mechanism to run their activities in available manpower. See, this will have, see, in government institute, we should not compare with corporate institutes. मी clear आहे. And I always tell to people, जे असे काही म्हणजे बरेच आपले कामगार म्हणा, आम्ही काम नाही करणार, वर्कलोड ज्यादा आहे. See, when I come to government institute, I know workload is simple. And I should be ready to do that. This is my personal view, it's not for any other one. My personal view of doing a government job. I will tell you, when I was lecturer, I used to get double the pay than what I used to get in fourth pay as a lecturer. 8,100 रुपये भेटायचे 2001 ला. त्याच्या दुप्पट मला प्रायव्हेट कॉलेज देत होते. बट आय हॅड फोरेन्सिक मिलते ही नहीं थे ना. Even when we applied 12 posts, only 3 applications, Dr. Sukhdeve, myself, Dr. Ruya. So my meaning, see, this will go on because this is a public institution. Demand will always be more. Workload is going to be there because it's a public institute. We don't have a right to say no to the public. A corporate or a private hospital or a private medical college has a right to say no to this poor people and all these medical legal activities. But as a public institute, as we are taking our pay calories based on the taxation of the public, आपण एक पेशंटला नाही म्हणू शकता का, we all have worked in all major medical college, even though beds are full, tari we are admitting, our clinicians are admitting, well, we are giving them floor bed, whatever is there. So this way, this will go on, sir. Undoubtedly, workload, technical matters have increased. I am Senate member in MHS also. Last week, I only given the budget of the MHS for 2 years. But there is always a way out. I would say all the head of the departments, whatever available resources, has to sit with their faculty members. And you should boost your faculty members. See, if आपणच जर म्हटलं मी फक्त 4 तास काम करेल, तर माझा लेक्चरर 2च तास काम करेल. फॅक्ट आहे, इट्स अ ह्युमन मेंटॅलिटी. मी आजही माझे काही रेसिडेंट आहे तिथे, बरोबर आहे, तुम्ही होता, आजही 7-8 वाजेपर्यंत मी ऑफिसला, कामच तेवढे. I am ready to do work. So it is your personal view, but I feel there is always a solution, and good work should not suffer because of all such activities. This is my, you have to put up to your dean, भांडावं लागतं सिस्टम मध्ये. See, आम्ही 10 वर्ष भांडलं म्हणून फोरेन्सिकला 5 माळ्याची बिल्डिंग भेटली मला. फॅक्ट इज, सी, इन पब्लिक इन्स्टिट्यूशन तुम्हाला आज केल्या डीन भेटत देणार नाही. कारण डीन इज ऑल्सो नॉट ए सुप्रीम ऑथॉरिटी. He has to put up a file to DMCs. आता मी होतो ना एवढे वर्ष, आजही चार्ज आहे, चार्ज काढला नाही कमिशनर. But still, the procedure, everything, the head of the department or the designated person of that department, त्या फायली म्हणतो ना, शासनाकडनं जर काम करायचे तर टेबल न टेबल फिरावं लागतं. जो व्यक्ती टेबल क्लिअर करू शकतं त्याचीच कामं होतात. सिंपल है. तुम्ही बना रहे हो, मेरा काम है क्या, हेड क्लर्क को तो मैंने प्रपोजल देके 6 महीना हुआ, डीन ने भी साइन किया है. ऐसा नहीं होता. इफ यू वांट टू डू some good work for your department, the head of the department has to take a lead along with the faculties and put an extra effort to see that good work is done in department. Undoubtedly, we have to ask to this data operator, you know, the bad part is there are few departments where there are no CCTVs also. HOD आता ANM होते, आम्हालाच भीती वाटते. आम्हीच बसतो कम्प्युटरवर रेसिडेंट बरोबर, भरा सगळ्यांची. HODचा पगार चाललाय ना एम मध्ये. म्हणजे इव्हन तो माय फॅकल्टी मे नॉट पंच बिकॉज ऑफ इनएडव्हरंटली ऑल्सो. असं नाही की आपण न येता पगार घ्यायचे इच्छुक आहे, फार कमी लोक असतात. बट जर मेजॉरिटी ऑफ स्टाफ इज वर्किंग, सो दी सिस्टम इज रनिंग. इफ मायनॉरिटी वे आर वर्किंग, एवढी मोठी सिस्टम रनच झाली नसते. इट्स अ सिंपल. सो सर, माय I can't advise you, or my boss. We have very good relation. You are so senior to me in medical teaching. I can only say there is a way out. Search that way out. and fight with the administration to get all your resources. You have to fight only. Simple, one-liner in. HOD has to fight with Dean, DMC, AMCs, put up your matter, go meet 10 times. ये नहीं होना चाहिए अरे एकदा भेटून आलो ना मी काही नाही होत एकदा नाही काम होस्तोपर्यंत भेटायचं जर आपल्या डिपार्टमेंटला काही पाहिजे असेल आपोआप भेटतं आज सुरू केलेली एक फाईल 2 वर्षांनी भेटेल पण भेटेल आशावादी राहावं लागतं सुरुवात येस you know there is a good proverb well started is half done म्हणजे तुम्ही चांगली सुरुवात करा अर्ध काम तिथेच झाले and have a positive attitude सगळे कामं चांगले असं काही नाही बघा ऍज ए फोरेन्सिक एनाटॉमिस्ट why we do law one of our paper 3 is related to body injuries in MD तिथे आमचं बॉडीली इंजुरीज आहे 302 325 24 306 हे सगळे बॉडीली इंजुरीज वी लर्न इन MD ओनली सो देन वी डू अँड सेकंड वुड बी एक डिग्री लागते आणि उद्या वाटलं विहारेच घ्यायची माझ्यासारखं काय रिटायर व्हायला आलेलं नाही ना मग झालं उद्या प्रॅक्टिस करू शकतो व्हॉट एव्हर वी कॅन डू सी additional degrees what Dr. Yuvraj and we did healthcare administration MBA from 5 years course night college we did from Garware we due sanction असं पळून जाऊन नाही proper procedure so that has given me an added advantage a jumbo's internal planning was done by me only त्यांनी फक्त टेंट भरून दिलता मला 10 तारखेला माझी पोस्टिंग झाली आणि 18ला इनॉग्रेशन केले 9 दिवसात 1100 बेडचं उभारून दाखव म्हणजे BMC team was there undoubtedly it is BMC who can do this म्हणजे that was support given by honorable committee सगळ्यांनी दिलेलं that is good part of BMC sir म्हटलं मी ओळखतो म्हणजे see BMC medical colleges ला is very easy to get work done if you compare with government if you compare because we are a semi autonomous body आपल्याला फक्त हेड ऑफिस मुंबईतच आहे इथं धुळा मेडिकल कॉलेजला काय घ्यायचं डीनला त्याला 10 चक्रा मंत्रालयात मारावं लागतं माझेच मित्र बॅचमेट कितीतरी डीन येतात सो इट इज इझी फॉर अस बट तुम्ही गव्हर्नमेंट कॉलेजच्या कोणत्या ऍडमिनिस्ट्रेटरला जा तुम्ही आणि आज धमकी किती चक्रा झाल्या मंत्रालयातल्या वर्षातनं जर त्यांनी नंबर सांगितलं तुम्ही म्हणून एवढं कसं जातात सो माय वे ऑफ सेइंग इज manpower would always be less as compared with your workload because these are public institutions. We have to devise our own methodology to cater all this and we have to see that our BMC organization, good work done by BMC is highlighted more and public at large is satisfied with you. I will not say that do excellent work, but public should be satisfied with us. ये लोग पगार ले रहे but अच्छा काम कर. So thank you.
Well, thank you for the last motivational talk. That's what made us realize why the governor of Maharashtra, called you to Raj Bhavan and felicited you and gave you the award. So with that, we break for lunch. For those who are online, please stay. We'll join back at 1:30. Students. Pradeep sir, I just wanted to do the mic check on Zoom. Can you speak something? Unmute yourself, sir. You are muted. Mute. Unmute. तुमच्या इथं समोर unmute ऑप्शन असेल.
Yes, sir. Good
Yes, sir.
afternoon.
Yeah, sir, your voice is absolutely clear. Thank you so
Okay,
much.
no problem. No problem.
Sir, so you तुम्ही परत फर्स्ट स्लाइडला शिफ्ट करा वरती.
Oh,
And
yes.
within 15 minutes we are starting. Huh?
Okay, okay. No problem. Yes.
तुमचा व्हिडिओ तुम्ही बंद करून ठेवायचा असेल ठेवू शकता हवं तर.
चालेल सर, चालेल.
अनम्यूट पण करू शकता त्यावेळेस म्यूट करा परत वाटल्यास. चालेल.
हो.
या व्हिडिओच्या निमित्तानं मी आपल्याशी काय संवाद साधणार आहे तो साधण्यापासून मी स्वतःला थांबवू शकलो नाही. याचं कारण म्हणजे रणदीप हुडा यांची एबीपी माझावरती मी आत्ताच मुलाखत बघितली आणि खरोखरच एक मराठी माणूस म्हणून माझं मन अभिमानाने भरून आलं, दाटून आलं. हरियाणातला एक कलाकार म्हणा किंवा व्यक्ती म्हणा स्वातंत्र्यवीर सावरकरांवरती चित्रपट निर्मिती करतो, ते दिग्दर्शन करतो त्याचं आणि स्वतः अभिनय करतो. आणि खर तर हा चित्रपट त्याच्याकडे पहिले एक अभिनेता म्हणून आलेला असतो, पण काही गोष्टी अशा घडतात की तो जिद्दीने ठरवतो की आता ह्या चित्रपटाची निर्मिती मीच करणार आणि त्या निर्मिती करता आपल्या वडिलांची परवानगी घेऊन तो आपलं स्वतःचं घर शेती गहाण ठेवतो आणि स्वातंत्र्यवीर सावरकरांच्या चरित्रावर भव्य अशा चित्रपटाची निर्मिती करतो. त्यामुळे मनापासून हॅट्स ऑफ रणदीप हुडा. आणि म्हणून मी तुम्हाला कळकळीने विनंती करतो, बरं जेव्हा त्यांना विचारलं गेलं की अभिनेता ते निर्मिती आणि दिग्दर्शन असा हा जो काही प्रवास याचं घडण्याचं कारण काय, तर त्यावर त्यांनी सरळ आणि सोपं उत्तर दिलं की जो हो गया सो हो गया, अभी मुझे आगे क्या करना है हे मुझे सोचना था. खरोखरच म्हणजे जे झालं ते झालं, त्याचा विचार न करता फक्त पुढे जात राहायचं. आणि त्यामुळे ह्या व्यक्तीमध्ये मला एक सच्चा कलाकार, एक सच्चा देशभक्त आणि सच्चा स्वातंत्र्यवीर सावरकर प्रेमी व्यक्ती मला आढळला. ती मुलाखत बघितल्यानंतर आपल्याला सुद्धा हे पटेल विचार काय म्हणतोय ते. आणि म्हणून मी तुम्हाला कळकळीची विनंती करतो की हा चित्रपट आपल्या सर्व परिवारासह, मित्रांसह थिएटरमध्ये जाऊन नक्की पहा. याच्या पायरेटेड कॉपीज बघू नका. या चित्रपटाकरता जो पैसा लागलेला आहे तो पैसा निघायला हवा आणि फायद्यात निघायला हवा, हे एक मराठी माणूस म्हणून मी तुम्हाला विनंती करतोय. आणि रणजित हुडा यांनी जे म्हटलेलं आहे की सावरकरांची देशभक्ती आणि सावरकरांचे विचार, त्यांचे चरित्र आजपर्यंत
दीक्षित सर, पहिल्यांदा सगळ्यांचं तुमचं इंट्रोडक्शन, चेअरपर्सनचं इंट्रोडक्शन होईल आणि मग आम्ही तुम्हाला रिक्वेस्ट करतो सर.
या ठीक आहे.
तुलसी प्लांट सर पहले सब सुमित करो.
तुलसी का भी सुमित सर. तुलसी का भी सुमित सर. ठीक है. Hello. Esteemed speakers, chairperson, and delegates, good afternoon to everyone. Welcome back for the post-lunch session. The topic for the first session of this afternoon is medical laws, laws related to medical practice. Chairperson of this session is Dr. Swati Rautela ma'am. I request Dr. Sumedh sir to welcome Dr. Swati ma'am with Tulsi plant. Dr. Swati ma'am is professor and head of Department of Law, former in charge director, Law Academy, University of Mumbai. Ma'am is an associate editor for SCLC Law Review at Shankar Rao Law College, Pune, India. The speaker for this session is Dr. Pradeep Dixit sir. Dr. Pradeep sir is professor and head of Department of Forensic Medicine and Toxicology at Symbiosis Medical College for Women, Pune. Dr. Pradeep sir held the administration of GMC Meerut as chairman of COVID-19 Management Committee. Sir was also member secretary of Medical Negligence Committee in GMC Meerut. Being the dean, Dr. Pradeep sir started clinico-pathological correlation CPC meetings in GMC Kolhapur. Dr. Pradeep sir has given a huge contribution in COVID pandemic at the GMC Meerut as chief controller and chief coordinator in COVID hospital Meerut. Sir was also a member of district task force for COVID management. Now, without further delay, I would request Dr. Pradeep sir to enlighten us with laws related to medical practice. Dr. Pradeep sir is joining us online. Welcome, sir.
Thank you very much. Thank you very much.
Yes.
I think I am audible to all. First of all, I will congratulate the organizing team for organizing this particular international webinar on a very good topic of forensic anatomy and medical laws. I'm thankful to the organizing committee for giving me chance to share this particular topic with all the delegates and the speakers here. I presume that all the participants, all the delegates, they are in some way attached to certain administrative work of the hospital wherever they are working, maybe in certain institutes, maybe in PSC, rural hospitals, district hospitals, medical colleges, etc. So with this presumption, I have prepared this particular presentation to benefit all as far as to know various laws which related to medical practice. My educational objectives for this particular presentation will be to make aware of importance of laws and different acts governing medical practice, to acquire knowledge regarding various important laws and regulations pertaining to medical practice, and after gaining the knowledge of various acts and different laws, can Association of Practicing Doctors recommend to the respective administration some changes in existing acts and to have a single window system to make easy process of opening and running a clinic or hospital or a medical college or labs for doctors. These are my educational objectives. Hence, I have divided my contents of presentation in different heads like this. I will not go into the details. We will go one by one all the contents of this presentation. To start with, whatever photographs which are there in my presentation, they are taken from the Google and are being used only for teaching purpose. There is no commercial gain in this. Coming to our topic proper, we all know that laws are there. What are the laws? Laws are the obligation on the part of a society imposed by competent authorities. So when you don't comply with these obligations and these acts, there will be punishment in the form of monetary fine or imprisonment or both. We all know that earliest known code of laws related to medical practice was a code of Hammurabi. So initially, I will tell you that as a hospital administrator, certain laws are very important, and the laws governing, and these are laws governing to the essential qualification, practice, then and conduct of professionals, laws related to sale, storage of drugs, safe medication, management of patients, environmental safety, employment and management of manpower, then medical legal aspects and laws pertaining to the safety of patients, public and staff within the hospital premises, then professional training and research, business aspects, licenses, certification required for hospitals. Then you should know, as a hospital administrator, latest amendments in all these laws, and should provide a quality care to the patients. So when we say of a law, it is derived from our constitution. Okay, so now what is the role of Constitution? What Constitution says as far as these laws are concerned? Constitution says that primary duty, it is the primary duty of every state to raise the level of nutrition and standard of living of its people. Then its primary duty also to improve the public health. They are the primary duties of every state. The Medscape India, this is a very well organized. This is an organization which deals with all the aspects of medical practice. And as far as study which was conducted by the Medscape India says that around 78% of the doctors feel that many of the laws that govern medical practice are outdated laws. Then because what happened that licenses and have to be procured, different certificates have to be procured by doctors running the hospital every year. So it is a difficult task, and then there should be certain changes in the laws and acts. Why the acts are needed? We are talking of medical acts related to practice, but what is the need of these acts? To answer this question, we should go to the history of these laws as far as medical practice is concerned. The oldest is a code of Hammurabi around 2000.
कुर्सी के नीचे से green wire.
Hello.
Sorry, sir. Sorry. I'll mute myself.
Yeah. So around 2000 BC, the Hammurabi, who was the king of Babylon, he formulated this code of Hammurabi, what is called as, and it was dealing with various aspects of health practices, fees payable to the physician for satisfactory services, and under this code, almost there were 282 laws, and these laws were written on the stone. So every public who were there, they can go through these laws, and what is expected to the public by the medical practitioners, it was there. It was enacted in this particular code of Hammurabi. About 800 BC back, 800 to 1000 BC, Charaka Samhita and Sushruta Samhita. These were formulated by Charaka, who was the physician, and Sushruta, surgeon. And then under this code, this was code regarding the training, duties, privileges, social status of physicians and surgeons. So, what are the role of physician, what they should do, etc., was there under this code of Charaka Samhita and Sushruta Samhita. Then about 500 BC, the first ever code of medical ethics, that is Hippocratic Oath, came into existence. It was formulated by Hippocrates, the Greek physician. He was called as the father of Western medicine. This particular oath, it was formulated to guide and to regulate the conduct of doctors for centuries. This was a guiding oath, which was guiding and regulating the conduct of doctors for centuries together. In 270 BC, in Ashoka period, again Charaka Samhita was gaining importance, and all the acts and different rules were framed under this Charaka Samhita. In 1807, the laws were enacted for the prevention of spread of dangerous epidemic disease. So under this law, various administrative things which are to be done to prevent the spread of dangerous epidemic disease was enlisted under this act. In 1857, British government felt that there is a need of some discipline and regulations in medical practice. The British government established General Medical Council in 1857 in England, and the British doctors employed in India were registered with this General Medical Council in 1857, and their behavior came in under the disciplinary regulation under this council. In 1860, Indian Penal Code was enacted, and now this Indian Penal Code has been transformed into a Bharatiya Nyaya Samhita in 2023, the last year. In 1871, as a part of criminal procedures and other purposes, Coroner's Act came into existence. This was for inquiry into the unnatural death. So it was only in Bombay and Calcutta. So under this Coroner's Act, judicial proceeding was being done. The necessary authorities were named, and then they used to inquire into any unnatural death where cause of death is not known, and this was covered under section 193 of Indian Penal Code. So role of medical professionals in work of conducting autopsy and inquest was very well mentioned in this particular Coroner's Act. Now both this Coroner's Act is abolished now, and it is being replaced by a routine inquest like police and magistrate inquest. Okay. So in 1897, this Epidemic Disease Act came into existence, and you are all aware in the corona, in this corona's epidemic. This Disease Act was utilized by our administration for various administrative work which they were doing for controlling this corona epidemic. In 1898, Lepers Act was repealed. In 1912, there was an act what is called as the Bombay Medical Act came into existence. Then in 14, Bengal Medical Act and Madras Medical Registration Act was formulated. In 1916, Indian Medical Degree Act was passed by Indian Legislative Council and it was approved by the Governor General. In 1933, Medical Council of India came into existence as per enactment of Indian Medical Council Act. So Medical Council of India came into existence in 1933, before independence. Now, after independence in 1947, the Hippocratic Oath was modernized, and modern version of Hippocratic Oath, what is called as the International Code of Medical Ethics, was adopted by the Third General Assembly of World Medical Association, London, England, on October 1, 1949. And we are now following this all over world. This is being followed. In 1974, Criminal Procedure Code 1973 was enacted, and now this Criminal Procedure Code has been replaced by the name Bharatiya Nagrik Suraksha Samhita in the last year, in 2023. In 1988, Grant Medical College, a society, passed a Bombay Medical Act and established what is called as the Medical Council. Under this act, appointment of registrar was how to appoint registrar, who will be the registrar, what are his duties, etc. was detailed in this particular under this act. Then maintenance of all practitioners. The registration of the practitioners was made mandatory under this particular act. Then there was a penalty also for doing a wrong thing under this act. In 2002, Parliament passed large number of bills and acts to strengthen the healthcare delivery of India. I will not go into the details of it, but so many bills and acts were passed. The important here in 2002 was a regulation which was passed by Indian Medical Council, what is called as Indian Medical Council Professional Conduct, Etiquette and Ethics Regulation 2002. Now this is again amended. All of you must have gone through certain draft which was there initially. It was taken back, and now finalized draft is yet to, I think it is yet to get released by the NMC, National Medical Council. Now, here under this regulation, there was a provision regarding offences and professional misconduct which may be brought before the appropriate medical council, maybe state or Medical Council of India. There were certain rulings which was passed by Supreme Court in 1989. These rulings should be known to all the doctors in our doctor community. In a landmark judgment that marked this momentous event was the case of a Paramananda Katara versus Union of India, who was also there for Consumer Protection Act in this particular event. But as far as this ruling was concerned, it was that doctor cannot refuse treatment in emergency on the ground of professional freedom. As we all know, we have got a right to choose the patient. But then this right will not be effective in this particular condition when you are treating a patient in an emergency. Then the second ruling was that not only government hospitals, but also every doctor, whether at a government hospital or otherwise, has the professional obligation to extend his or her service with due expertise for protecting life. So whenever this particular question of giving treatment in emergency is concerned, no rule can surpass the doctor or prevent the doctor from giving the health treatment in emergency situation. Again, in another case in Supreme Court has passed a ruling that failure on the part of government hospital to provide timely medical treatment to a person in need of such treatment results in violation of his or her right to life guaranteed under Article 21 of the Indian Constitution. So all doctors should know these rulings passed by the Supreme Court. But then still, we are not immune from any criminal liability. Whatever criminal liability which is there for other normal residents is also due for medical profession. But then we have got certain many defenses against these offenses, and these defenses mainly are informed consent, necessity to do that particular action, and the action which is done in a good faith. These three are the defenses against these offenses given to a doctor by criminal law. Okay, so all should know all this particular thing. Now I will enlist the different laws and acts which are generally helpful for medical practitioners in the administration and related and many other areas related to treatment or management of the patient. In only some acts I will elaborate it, but most of the acts I will just mention the things. And before starting this, I will say that as far as administration is concerned, hospital administration is concerned, they should have a copy of their act of all these things with them, because you don't know when the act will be of use to you. And the hospital administrator should go through these acts frequently to make their hospital updated, and so that they are not abiding or they are not overruling certain provisions which are listed in the act. Okay, so to prevent this action from the administration, you should be aware of all these acts. Okay, of course, there are a number of acts. I might have missed some of the acts. And hence, all the administrators, hospital administrators should go through these. They should search for the acts. Where acts are available on the Google, and they should go through it and make them updated as far as the different laws, rulings, regulations which are mentioned in the act. Okay, so one by one we'll go. I have divided it into different headings like laws applicable to hospital and medical college as far as administration is concerned. Okay, they may not be useful directly for the doctor who is just treating the patients, but then those who are involved in administration of the medical college or the hospital, these laws will be useful. The first is the Atomic Energy Act 1962. So wherever there is a department of radiation, radiology, radiation therapy, radiotherapy, nuclear medicine, etc., they should go through this Atomic Energy Act 1962, where they have to prevent, they have to do certain acts which will prevent unnecessary irradiation to the people who are coming in that particular department. So what they want to do, they should do certain preventive action. What preventive action is to be taken, all is elaborated under this particular Act of Atomic Energy Act 1962. Then Bombay Lift Act. Now lifts are there in every infrastructure. Whatever hospitals which we are visiting, there is a provision of lift. So now this lift is governed, because I will tell you one example. When I was working as a dean at GMC Kolhapur, there around 15 years ago, there was one accident where a patient had a death. He was trapped in the lift, which was being maintained by that particular person who was maintaining the lift, that particular company. It was basically a fault of that particular company who was maintaining that particular lift. But then ultimately responsibility came to the dean of that particular institute, and the government has to pay around 25 lakhs as a compensation, which was awarded by the court. So this particular incident was there just because we were not aware of all this act, whatever is written in the act. So approvals of the lift, how many number is to be given, is to be provided in that particular infrastructure. What are the documents for license? There should be a license. Then penalty for violation of rules, checklist before buying, etc. are given under this act, Bombay Lift Act 1939. Then there is a Company Act. If the hospital is being run by one particular company, then whatever documents which are needed to form a company, what should be done, etc. is given in this particular Act 1956. Indian electricity was 1956. Many times we think that we are given one contract to an electrical contractor, and he will do whatever things, whatever electricity, whatever different things, instrument, equipment required for proper electricity distribution in that particular hospital. And we think that probably he will be responsible for all the things. But once all electrical contractor installs all the equipment, instrument required for proper electricity distribution in a particular hospital, then when you take over all these things, it is the responsibility of the owner of that particular hospital to maintain the safety measures to protect all equipment used for supply of electricity and to prevent from any untoward incidents because of electricity. So this is the responsibility of the owner and not that particular contractor. Okay. This is the important, this is Maharashtra Anatomy Act. So as this is being, this webinar is being conducted by the Department of Anatomy. So you are well aware of this particular act, which was there. It was Bombay Anatomy Act 1949, was modified later on with different amendments. And here this act was basically for providing the bodies for anatomical examination. So unclaimed dead bodies were used. Some are body donation, some are voluntarily donating the dead body of their own or the relatives, etc. So whatever precautions to be taken are who are eligible for donating the body, etc., have been laid down under this act, Maharashtra Anatomy Act. Here, which unclaimed dead body can be given to a Department of Anatomy where cause of death is there is no doubt regarding cause of death. When there is no doubt regarding cause of death, this body can be given to the Department of Anatomy. Now, who is the authority who will decide that this body is to be sent to anatomy? It's a medical superintendent of that particular hospital. He is the authority to decide whether this body is to be given to anatomy department or not, and later on, the Department of Anatomy will decide whether this body is fit for the for anatomical dissection or not. So, of course, under this act, the MS or the authority is given. You can say that he can form certain rules, regulations regarding the donation purpose, body donation, and also accepting an unclaimed dead body. Different colleges have got different rules. When I was working at a GMC Nagpur, there the rules were that when unclaimed dead body where cause of death is well certified by the clinician, if this body comes to you and whether it is fit for anatomical examination, then we will embalm that particular dead body, and we will keep those bodies in a separate tank, formalin tank, and we used to keep that particular tank very tagged with whatever number which we are given for about 1 month. And within 1 month, if relatives come with and if they claim that particular body, so after proper identification, we used to hand over that particular body to the relatives. But after 1 month only, we used to take that particular body for anatomical examination. These were rules framed at a local level. There is no such guidelines given in this particular act. So for how many days you should keep that particular body for identification purpose. But then MS is given this particular authority to form the rules. But when the cause of death is doubted, when suspicion, then you have to inform the investigating officer or the police of that particular area, and they will inquire into the cause of death. If after inquiry they think that this is the natural death of an unclaimed dead body, if this is a natural death, probably may be certified by the clinician or not. If this is a natural death, then only he can directly give this body to the Department of Anatomy without doing postmortem examination. This particular power has been conferred under section 174 of Criminal Procedure 1898. Yes, so these are all. I will not go into the details again, but then yes, I already told you that authority is MS. Yes, now coming to this particular act, this is again a very important act. All should know about this Act, Transplantation of Human Organs Act 1994, which was amended again 2014. Probably there may be amendment later on also. Basically, this act was to provide a system of removal, storage, transplantation of human organs for therapeutic purpose and for the prevention of commercial dealings in human organs. All are aware of different news in this regard. Most common donation is a organ donation is a kidney donation. Okay, so again, all the regulations, all the authorities, what are rules, what are the procedure to be followed, etc., are given under this particular act, and all should know regarding this act: live donation and cadaveric donation. Problem come in a live donation. Most of the problems they are there with a live donation. Okay, so this is very important. Then what is that brainstem death? What is brain death? Who will declare a brain death? The board of doctors who will declare the person brain dead, etc. All is there under this act. Then there is State Nursing Home Registration Act 1953, Electricity Act 1998, National Building Act. Now this National Building Act 2005, it was having the importance, particularly when certain incidences of fire in a hospital, and then the collapse of certain roof of the hospital, etc. These incidents, they have triggered the provisions which are given in this National Building Act, that there should be certain structural audit. Structural audit should be conducted by the PWD department. By the PWD, if it's a government setup, by the PWD department, if it is more than 20 years old, the building is more than 20 years old, for every I think 2 years or 3 years, there should be certain structural audit should be taken. Then Maharashtra Fire Prevention and Life Safety Measures Act 2006. Again, this was very, this act was very important, particularly in the light of incidences of fire in ICU, fire in PICU, etc. So under this particular act, again, provision was there that how to safeguard the life of a patient and employee who is working in that particular hospital. Fire safety audit has to be conducted each and every year to improve the overall status of the fire safety measures. Section 3 of this says that who will be held responsible for providing required fire protection and prevention system. You said that yes, it is a department of PWD who will do all these necessary preventable things, but then it is the owner who is responsible for giving all the safety measures. Maintenance of this fire safety measures is the responsibility of owner and occupier of that particular building, and not of a service provider. Okay, so then 11 again, Atomic Energy Regulatory Board, ERB, what is called as. Now this is the board which gives regulatory consent, different types of regulatory consent, like starting of certain establishment where radiation measures are utilized. Okay, so this is giving license, then giving license to the employees. Who will be the employee? What should be the essential qualification of that particular employee who is working in such type of establishments? So all this has been elaborated under this particular act. Then the Department of Radiology, then radioimmunoassay labs, nuclear medicine lab department, all they will come under this particular act under the AERB regulations. Society Registration Act. This should be known to administration, that if the hospital is being run by the society, what are the essential documents they need, essential licenses they need, essential permissions they need to run the hospital. This is again a new act, what is Clinical Establishment Registration Regulation Act 2010. Lot of hue and cry was there when this was passed, this act was passed. Here the definition of clinical, what do you mean by clinical establishment? Then this registration is important with the health department. Standards to be followed. What should be the infrastructure to start a laboratory or to start a clinic or to start a hospital, 10 bedded, 20 bedded, 40 bedded, like that. So all these standards are given under this particular act. Then renewal of registration is very important. Just at the start you register your hospital with that particular agency or with the health department will not suffice. You have to renew it, registration every 5 years. Now, certain laws which govern the qualification, practice, and conduct of professionals. So, what should be the essential qualification of the persons who are doing their work in your hospital? This is all governed under this particular these acts. What is first is the Indian Medical Council Act, 1956. So, all practitioners, all the doctors should be registered under this act. Then Indian Medical Council Professional Conduct, Etiquette and Ethics Regulation 2002. So all medical professionals are governed under this particular act. Indian Medical Degree Act 1916. What should be the degree? Which degrees are recognized by the Indian Medical Council, etc. Then Indian Council Nursing Council Act. Regarding this maintains the professionals, particularly those who are engaged in nursing profession. So what should be the degree, their nursing qualification, whether it is registered or not, etc., is given under this act. Dentist Act, similarly for dental people. Then AICTE rules for technicians, because you are employing the technicians also. So their degree, whether the degree is recognized or not, recognized by some authority, then what should be the experience, etc., is given under this act. These are rules. Then paramedical and physiotherapy Central Council Bill. Similarly, same for physiotherapy and paramedical persons. Pharmacy Act, very important, because you are storing drugs, you are distributing drugs, you are purchasing drugs. So all the things, necessary rules are there framed under this particular act. Then Apprenticeship Act. Apprenticeship Act means you are keeping certain trainee doctors or trainee paramedical persons in your hospital. So what should be the age of those trainee, etc., is given in this particular act. Then laws governing sale, storage, drugs, and safe medication. Okay, so certain these laws are very important. Many times action is taken against an administration for wrongdoings as far as sale, storage of drugs are concerned. The important here is the blood bank regulation under drugs and cosmetic rules, 1999. Now there is definite rules, regulations which govern the functioning of the blood bank. Now blood banks are called as the blood centers under this notification of MHW dated 11/3/2020. The blood bank, instead of calling bank, it is called the blood centers. So under this notification, under this act, it's which is the licensing authority. Renewal of license is very important. Ideal infrastructure. What should be the ideal infrastructure of a blood bank? Then who should, as far as manpower, educational qualification is concerned, what should be the educational qualification of various people, the employees which are working in this blood bank, etc., is given under this particular act. Then who should be the ideal donor, and what are the contraindications of donation of a blood? They are very well framed under the notification which was issued by MHW. So this should be followed very strictly by the people who are working in blood bank. Then third is the excise permit to store spirit, because you need spirit in every hospital, even clinic and even dispensary. So here spirit is important. So under this is guided by Central Excise Act 1944. Then as far as IPCs are concerned, section 274 deals with the adulteration of drugs, 275 with the adulterated drug, sale of adulterated drug, then 276 sale of drug as a different drug or preparation, 284 as a negligent conduct with regard to poisonous substance. How this should be stored, how they should be identified. It should be kept in a lock and key. These dangerous poisonous drugs, etc. Then Narcotic and Psychotropic Substance Act 1985, Amendment Act 2023. So importance of this is that many times hospitals they store morphine, pethidine. So these are the narcotic drugs, and then how they should be kept, how they should be stored, how they should be purchased, from whom you should purchase, etc., is given under this particular act of 1985. Importance is that whatever offences under this act are non-bailable and they are cognizable. So investigating officer will directly catch hold of that particular administrator or who is in charge of that particular hospital, and there is no role of giving any bail. Okay, so balance between control and availability of narcotic drugs is to be maintained under this act. Okay, then Pharmacy Act 1948 is very important, which deals with various drugs, how to store drugs, how to purchase, how to keep the record of the drugs, etc. Then Drug and Cosmetic Rule 1945, Drugs Control Act 1950. Then Central Sales Tax or VAT Act, again 1956 for administrator, it is very important. Then coming to the laws which govern management of the patients. The important here is a Birth and Death and Marriage Registration Act 1886. Different amendments are there later on also. The importance lies in the fact that every death has to be notified under MCCD. MCCD means Medical Certification of Cause of Death. This we are giving exercise in second MBBS students routinely. Then PSM people, they are also giving training to the doctors, to the residents, how to fill this MCCD form. Because this is very important, because vital statistics all is based on whatever you are writing in MCCD. So the MCCD is very important. You have to notify the corrections in the name, how to correct the name, time limit for information, after death of a person or after the birth. Within how much time, within how many days you have to inform to the concerned administration. Then penalty for not informing in time. Who is eligible to report birth and death? Who will issue form number 4 in medical legal postmortem cases? Now, this is all given under this particular act, Birth and Death Registration Act 1886 and various amendments thereof. And Drugs and Magic Remedies Act. This also you should know, because sometimes there may be the certain advertisement of certain drugs that this drug is important, or this is very it cures certain disease process. So this such type of advertisements are banned under this particular Act of Drugs and Magic Remedies Act, Advertisement Act 1954. Then the administration also should know Guardians and Wards Act, because sometimes what happens that there is no one, some minor is admitted and no one is there with that particular minor. So who should be a guardian of that particular patient? All the necessary directions are given under this act. And Indian Lunacy Act, Mental Health Care Act 2017. So if you are managing a lunatic person, then what are the provisions for their custodial care for persons with lunacy and idiocy? So the definite rules are there to manage a lunatic person. Okay, so how to admit them, when you should discharge, who is the authority to take care of that particular person, how to take care of a patient who is admitted as a psychotic disease, or he is suffering from some psychiatric disorder. Whether he is permissible to keep, is it permissible to keep such patient in a general ward? What should be the infrastructure of such type of ward? All is given under this particular act. Then Law of Contract Section 13. So definition of consent is given in this particular act. So how a consent is to be taken? What is meant by consent? We are discussing regarding informed consent. Right now, it is the important for all of us that it should be always, whatever consent, it should be informed consent. Okay, so this is given under this Law of Contract Section 13. Then this is again recently we have already talked of Criminal Procedure Code, what is now it's called as Bharatiya Nagarik Suraksha Samhita 2023. This act now is very important. Those who are gynecologists, those who are radiologists, or those who are working in a genetic lab. Okay, so this PCPNDT Act 1994 and Preconception and Prenatal Diagnostic Technique Rules 1996, Amendment Act 2002. These are all, this is very important. I will not go into the details of it because of that time strain. But then this is basically to prohibit prenatal diagnostic techniques for determination of sex of a fetus leading to female feticide. So this act is very important. Here, no escape to the erring radiologist and sonologist. If they do certain wrong things, if they do certain things which are against the rules, regulations framed under this act, there is no escape to the radiologist and sonologist in this particular act. Registration under Section 18 of the PCPNDT Act is must. Anywhere, any establishment conducting the prenatal diagnostic test or conducting sonography, conducting some certain X-ray examination or certain genetic labs, so those should be registered under this particular act. Written consent of pregnant woman and a prohibition of communicating the sex of the fetus under Section 5 of the act is very well mentioned under this act. Maintenance of records is very important. Record maintenance under this act is very important. Creating awareness among the people, public at large, by placing board of prohibition on sex determination at your institute, at your establishment is very important. As far as punishment is concerned, under this act, punishment will be in the form of suspension of your registration. It may be filing of a criminal case against you or sealing of the machine, particularly the sonography, which is used for sonography. They will seal the machine. Okay, so this is very important. Then, what are the procedures? Prenatal diagnostic procedure under this act? They are defined as ultrasonography, fetoscopy, taking or removing the samples of amniotic fluid, chorionic villi, blood, or any other tissue or a fluid for being sent to genetic lab or a genetic clinic for conducting any type of analysis or prenatal diagnostic test for selection of sex before or after conception. So generally, the importance of this act lies in the fact that in generally whatever crime if conducted, the prosecution side will give the history to the court for trial, during trial. Now, it is a prosecution has to prove that a particular person has made a crime. Okay, this is the story as far as other crimes are concerned. But as far as the crime under this act is concerned, onus of proving not guilty is on the radiologist and sonologist and not on the authority. So if authorities say that you have done the wrong thing, then it is the sonologist or that particular accused person to prove that he is not guilty. Okay, so this is this is different than other crimes. Then laws governing the environmental safety. So whenever a hospital is there, you should see to it that you are not polluting the environment. Okay. So under this act, there is a one what is called as the Air Prevention and Control of Pollution Act 1981, Biomedical Waste Management Handling Rules 1998, amended in 2000. Then different schedules are the Schedule 1 and 5 of Biomedical Waste Management and Handling Rule 1998. All this under this, it is we are all aware of this particular fact. Different bags are there, color coding is there, and you have to segregate it. At the point of segregation itself, they should be segregated in a proper colored bags, so that the management is important for them, for that particular agency. The Environment Protection Act Rule 1986, NOC, you should have an NOC from Pollution Control Board. So anyone, when you are starting your hospital or your college or your institute, so you have to have an NOC from Pollution Control Board to start with. The Noise Pollution Control Rule 2000, you have to follow the different rules which are enacted under this rule. Water Prevention and Control of Pollution Act 1974. This is again a very important one. The Pollution Control Board is taking action against those institutes or hospitals where their water, which is particularly the water from toilet, washings, laboratories, clinics, etc. If they found that the water is going directly to a municipal corporation drainage line without getting treated, so they will find that particular administration. So the STP plant is very important. Sewage treatment plant, what is called as. So whatever the sewage which is getting collected at different or it is generated, it has to be collected in one particular pond. From that particular pond, it is to be treated with the STP, what is called as sewage treatment. Different procedures are there so that it becomes neutralized, it becomes unpolluted, and then it has to be reused, particularly in your setting itself. So this is very important. Prohibition of smoking in public place rules 2008. So though it is what is called as a public place, if you have got a multi-specialty hospital, there also the large number of people visiting, the patients, their relatives, etc., they are coming. So there also you have to take precaution that this proper notification should be there in your settings. IPC section 278, making atmosphere noxious to the health. Section 269 deals with negligent act likely to spread infection or a disease dangerous to life, unlawfully and negligently. So all these acts are there to deal with such type of actions. If you are not taking proper precautions, you will be held guilty. Coming to the laws governing employment and management of manpower. So this is very important, particularly for finance department. Okay, finance department of that particular hospital, the accounts section, what is called as. So they should be well aware of these acts. Bombay Labor Welfare Fund Act 1953, Bombay Shop and Establishment Act. Under this act, establishment, our practice, as far as medical establishment is concerned, the practitioner clinics, polyclinics, maternity home, hospitals, dispensaries that employ 10 or more persons will be covered under this particular act. What is called as establishment will be called as establishment under this act of Bombay Shop and Establishment Act 2017. Okay, so those just a clinic is there only having 1 or 2 employees there, it will not be covered under this establishment act. Employees Provident Fund and Miscellaneous Provision Act 1952, then Equal Remuneration Act 1976. So irrespective of the sex of a person, if the 2 male and female is doing the same type of work, same remuneration should be given under this particular act. The ESI Act 1948 and Rules 1950. Many employees are governed under this ESI Act, and they get a benefit to the employees in case of sickness, maternity, employment injury, or to make provisions of certain other matters in relation to your profession. Okay, so this act also should be known to the administrator. Then Indian Trade Union Act. So when a union, you should be just aware of this fact that any union, if someone has given you a representation saying that we have formed one union, if union is not of 7 or more members, it is no more a union. Okay, so to say that it is a union, or at least 7 members should be present. Industrial Dispute Act 1947. So many judgments are there of a various courts at various levels that hospitals, they come under industry. Okay, so I think we have got a madam itself is a professor in law college, so she will guide us in this regard. Much more we are not well aware of details of the act, but then we should be aware, because when we as the administrator at government medical colleges, so many cases are there pending in industrial court. Okay, so in that particular act, when we are dealing with the case, we have come to the certain judgments that yes, hospital is an industry. Maternity Benefit Act 1961. Again, all should know this, that the benefit should be given to the female employees under this particular act. They are entitled for different benefits. Minimum Wage Act 1948. This is very important. Again, we have seen even in a government setup also, we outsource the service. Say for example, the service of cleaning, dusting, and then keeping all the things, what is called the hospitality management. So we are outsourcing the service. We as the administrator think that once we outsource, it is not our responsibility to look for the people who are working for that particular agency. Those which are employed by the agency, we are not worried about that. So their payment, their different rules, regulations, whether they are following it or not, etc., is to be looked after that particular outsourced agency. But this is not true. We have to look as an owner of that particular, primary owner of that particular establishment. We have to look for whether those who are employed by the outsourced agency, whether they are getting minimum wage or not, whether that particular agency is giving all monetary benefits which are framed under this various acts of EPF, Employees Provident Fund, whether they are cutting that particular fund regularly in each month or not, whether depositing the same amount in their account or not, whether there is a separate account or not, etc., is dealt with under this Minimum Wage Act 1948. So we should be aware of this particular act when you are working with in a big institute. Negotiable Instrument Act 1881. Many times such type of problem they come that as far as checks are given, checks are not cleared or like that. So different rules, regulations regarding the negotiable instrument means which promissory note, bill of exchange, or check payable either to order or to bearer. So related to this rules, regulation, the act is there. Payment of bonus act, gratuity, wages, disabilities act, then PPF Act. All these acts are there dealing with the manpower. Okay. Then Shop and Factories Act 1963. Again, here what they said under this act, that medical practitioners, clinics, polyclinics, maternity homes, hospitals, dispensaries that employ less than 10%, they are exempt from applicability of this act. However, others are governed by this particular act. and you have to follow the rules regulations under this act. Essential Service Maintenance Act, what is called as the ESMA, 1981. The essential services are defined as hospitals and the other healthcare system, utilities such as electricity, water supply, law enforcement agencies, firefighting, food services. So many amendments also are there, but then this use of this ESMA was there in Corona epidemic. Now this in Corona epidemic, so many nurse, paramedical staff or even the doctors, they refuse the duty. So collector was empowered to finally lodge a complaint against this ESMA, against those persons under this act. What is ESMA? And they called the persons for doing their job. Then TDS under GST Act, accounts people, they should know this. But if you are many of the participants, they may go to the position of medical superintendent or to the position of dean and director and joint director. So they should know this, that there is certain system like that, TDS under GST Act 2017. When you have purchased certain equipment and you are now giving the bill. So in this bill, whatever GST which is there, out of the GST, 50% has to be given by you itself. TDS, what is the tax deducted at source? Okay, so this is one thing you should know. But then here, what as well as hospitals are concerned under this act, hospitals are exempt under GST. However, a GST rate of 5% will be levied on the cost of a hospital room if it exceeds 5,000 per day. If the rent of the bed or the hospital room is more than 5,000 per day, then you have to give 5% GST. Payment of Gratuity Act 1972, Workman Compensation Act 1923. Here also the insurance that provides cash benefits and the medical care of the workers who are injured or become ill as a direct result of their job. You have to look for that under this particular Act of Workman's Compensation. Now coming to medical legal aspect, laws governing medical legal aspects, the important one for us is the Consumer Protection Act 2019. Now this Consumer Protection Act 2019, here who is consumer? Consumer is the person who buys any good or avails services for consultation. As far as medical practice is concerned, we are providing service at the cost of certain fees, certain consultation fees, and hence we are the patients are the consumer in under this particular act. Now different redressal forums are there depending on the compensation which is awarded. So if the compensation is less than 1 crore, if you are asking for a compensation less than 1 crore, you have to go to the district forum, District Consumer Dispute Redressal Commission, CDRC, what is called. So it's a district CDRC when the amount which you are demanding is less than 1 crore. If the amount is 1 crore to 10 crore, it will be the state CDRC or commission. And if it is the more than 10 crore, it will be the national CDRC or commission. Of course, the final appeal is to be given either Supreme Court. Supreme Court you can appeal in the Supreme Court against a direction, against any rule or any judgment passed by the national CDRC. Here again, the product seller, it means manufacturer or a service provider. And what is liability? It is the responsibility of that particular manufacturer or the service provider. This is what the responsibility. So these two terms are very frequently used, product seller and product liability. Hence, I have given this particular explanation. Now under this act, who is not a consumer? This should be very well known to all the person, particularly those who are working in government setup. The person who obtains goods free of charge. If no money is claimed for purchasing any good, so he will not be called as a consumer. Then services which are given free of charge. If services are given free of charge, he is also not consumer, except when, particularly the hospitals where whosoever the patient is coming, if you are giving service free of cost to all the patients, irrespective of their income or irrespective of their category, etc. So they will not be termed as consumer. But then, if particularly in government hospitals, we know that depending on the income limit, we are charging the patient. All patients are not charged free of cost. Okay, so here in government hospitals also, the doctors who are giving service in government hospital, they can be charged under this Consumer Protection Act. So the patients can be the consumer in government hospitals also. Patients in government hospitals, some persons will be under poverty line and they are giving free of charge treatment. Okay, but then other persons who are more than, they have got an income limit more than that of a poverty line, so they are charged, and hence the patient who are not giving any fees, they are also consumer. Okay, you keep in mind this particular thing. Under this act, again, harm means any personal injury, illness or death, mental agony, emotional distress attendant to the personal injury, disease or damage to the property. So this is what is called as harm under this particular act. Now, under this act, the consumer rights are very important. They are guaranteed under this act. Now, what are those guaranteed consumer rights under this act? Number one is right to safety, right to be informed, right to choose, right to be heard, right to seek redressal, and right to consumer awareness. These 6 rights are guaranteed under this particular act. The number 2 important is the right to be informed. So what we are saying, that when you are doing any operative procedure or any medical procedure, you have to take a consent, and this consent should be an informed consent. This should be an informed consent, because this right is given under this act, that right to be informed. So which procedure they are doing, what are different side effects of that particular procedure, what are the terminal effects of that particular procedure, are there any alternative procedures available for treating that particular disease condition, etc. should be known, should be informed to that particular patient. So this is very important. Then what is deficiency under this act? When you are said that no, there is a deficiency. Deficiency means any act of negligence or a omission or a commission by such a person which causes loss or injury to the consumer. Second number, deliberate withholding a relevant information by such person to the consumer. This is a deficiency, what is called as under this particular act. Again, there is one important thing, is unfair contract is not allowed. What is unfair contract? So if you take a consent of the patient at the time of admission itself, that when if that particular patient needs emergency treatment or surgical treatment, I have got no objection that I will be referred to so and so doctor. If you take like this consent at the time of admission of that particular person, this is an unfair contract. This is unfair contract. It is not. You cannot say that he has given consent for this particular thing. Then again, under this act, misleading advertisements are also not allowed. Amendments are there now in 2019. Certain amendments are there. In the amendments, e-commerce entity has been brought into this particular act. E-commerce means when you are giving any medication, any advice on phone, on WhatsApp, on prescription, you are given and certain thing has happened to that particular person, he can claim that damage under this particular act. Okay. Now, other thing is important is the constitution of what is called as the Central Consumer Protection Authority. Now, this under CPA, Central Consumer Protection Authority has been created, and appeal and this authority has got a provision that they can suo motu inquire into an incidence of a negligence or certain unlawful thing which has occurred under this particular act. So suo motu they can start an inquiry, and they will then refer that particular case to a particular district magistrate, district forum to inquire into the incidents. Okay, so this is a new thing which has come under this particular act, Central Consumer Protection Authority. Okay, so now under this particular act, again a new amendment is that consumer can the complaints can be resolved through mediation. So if two parties which are there, if someone is there who will mediate the two parties and they will settle the problem. So this is allowed under this act because of this new amendment. But then once the settlement is there, no new complaint will be lodged against that particular party, the second party. This is also true. That once the mediation is there settled, he cannot file an appeal against that particular mediation in a higher forum. Okay, so this is very important thing. Then fees. you should be aware that when there is a result or the order from a district court, district forum. So district forum has passed certain order or judgment. Against that particular judgment, when you have to appeal in a state commission, you have to pay 50% of the total award amount passed by the lower court, lower forum. So this also is very important. Yes, this is regarding Consumer Protection Act. Second is Law of Privileged Communication. Now this is under section 124 of Bharatiya Saksha, the Indian Evidence Act, what is called as Indian Evidence Act. Bharatiya Saksha Bill 2023, now it is called as. So here, no public officer shall be compelled to disclose communications made to him in official confidence when he considers that a public interest would suffer by the disclosure. So no one can pressurize you to give this particular information which is public interest is involved, where public interest is involved. Okay, so this is a safeguard to the doctor community. Then under this Indian Evidence Act, again, yes, in 2023, it has been replaced by what is called as the Bharatiya Saksha Bill 2023 against Indian Evidence Act, which was there in 1872. Then I have already said regarding Bharatiya Nyaya Samhita, what is IPC initially, now it is Bharatiya Nyaya Samhita 2023, section 52. Any act done in good faith is always safeguarded. Then under section 80, accident in doing lawful act. Then 89 for insane and children, 90 for consent under fear, 92 for good faith and consent, and 93 for communication in good faith. So all this protection is given under this particular acts of IPC. Coming to the safety of patients, public and staff within the hospital, certain acts are there where you have to look for that your patients are safe, your public who is attending, staff who is working in the hospital is safe. So under this act, what are these acts are radiation surveillance procedures for medical application of radiation 1989, radiation protection rules 1971. So under these acts and under these rules, different procedures are laid down so that administrators should do all these things to have a safety of patients, public, staff within the hospital premises. Then ARV safety code, we already mentioned this. Then Arms Act, Boiler Act, Explosive Act, gas cylinder rules. Because we are keeping in the hospital, there are gas cylinders, there are explosives, there are boilers, there are arms, etc. So all this, you should go through it and what should be done to prevent unnecessary things which may be troublesome for you later on. Then Insecticide Act, NOC from Chief Fire Officer. Yes, that is very important when you start your establishment. You should have a NOC from Chief Fire Officer. Petroleum Act, storage rules, because sometimes you have to store diesel for your diesel generator, and this act will be of use to you, how to store the diesel, etc. Then prevention of food adulteration. Yes, that is again a very important law. Then different IP section 336 acts endangering the life or personal safety of others. What should be done? Then 337 causing hurt by act endangering the life or personal safety of the others. 338 causing grievous hurt by act of endangering the life and personal safety of the others. State Medicare service persons and Medicare service institutions prevention of violence, damage, loss to property and Act 2008. This was again a very important for all doctors having certain hospitals, clinics, etc. A lot of incidences were there where because of just the certain untoward thing which has happened to the patient, and relatives are saying that no, there is a negligence of a doctor and they are damaging the property of that particular doctor. So against to control this, to protect the doctor from such type of incidences, see, this act came in 2008. Yeah, so now laws governing the professional training and research. So whosoever professional persons who are working in your hospital, there are certain rules who should be employed, what should be the essential qualification of that particular person, etc. This is given under this MCR rules of MBBS, PG and internship training, National Board of Examination rules of DNB training, ICMR rules of governing medical research. If you are doing, if your hospital or institute is there who is doing research work in different medical the specialties, then you have to follow these rules of research. framed by ICMR. Then Nursing Council of India, they have certain rules regarding nursing training, what should be the given, what should the facilities to be given to the nurses, what should be the qualification of the nurses, etc. Then ethical guidelines for biomedical research on human subjects. This is again a rule. Guidelines are given, and then according to the guidelines, we are working on a research on biomedical research on human subjects. So what should be, what principles you have to follow. Then regarding business aspect, now particularly all the big establishments, medical colleges, even government hospitals also, they have got their chartered accountants with their registered chartered accountants. So generally they look after these acts, but then you should have certain knowledge of this Cable Television Network Act, Charitable and Religious Trust Contract Act, Copyright Act, Custom Act, Foreign Exchange Management Act, Gift Tax, Income Tax, Insurance, Sale of Good Act, etc. Okay, so these are different acts and rules. Coming to license and certifications which are required for the hospitals. These licenses and certificates are required for many things. Number one is registration. Starting from registration under the Societies Registration Act, initially you have to do it. Inspection of electrical installation substation, initially you have to do it. NOC you have to take from local municipal office or any such authority initially to start with. Then license for storage of petrol, every 2 years you have to renew it. Income tax exemption certificate, every 3 years you have to renew it. Then NOC you have to take from fire service. Then registration of operation of X-ray installation with ARV. Every 2 years you have to do this registration or renewal of registration. Then drug license every 5 years. License to operate blood bank every 5 years. Registration under PNDT Act every 5 years. Then income tax registration, PAN once only you have to do it. Then sales tax once only. Registration for EPF once only. Registration on ESI coverage once only. Registration under Rule 34, particularly MTP Act, one time registration. Registration under state nursing home, yearly you have to do it. Indemnity insurance, yearly you have to do it. Standard fire and special peril policy, yearly you have to do it. Then BMW, yearly renewal is necessary. License for operating lift, yearly you have to renew it. Biomedical waste generation, annually you have to do it. Then income tax annual returns, you have to submit annual returns. Units processed in blood bank, monthly you have to give this information to the proper authority. Periodic reports and returns as a legal commitment. So biomedical waste generation yearly, MTP reports monthly, then PCPNDT reports monthly, Employees Provident Fund monthly, ESI Act monthly, VAT monthly, registration boards of deaths, every occurrence. For every occurrence, you have to inform to the proper authority. Post polio paralysis case, you have to inform after every occurrence. Communicable disease report, every occurrence. Radiologist registration under PNDT on induction of new radiologist. USG machine registration on induction of each machine. Needle stick injuries on occurrence. TLD batches monitoring, quarterly you have to do this. Dosage received by this, for this is TDS, quarterly. So take into consideration all this information regarding laws and what are different types of laws, why they are needed, etc. When you come to know all these things, I think the new doctors and new registered practitioners, they will say it will be better if I work in a government hospital rather than a private hospital, or whatever private hospital they are running. They will, if they come to know different punishments under this act, and if you don't follow this, you will be blamed, or there will be certain allegation like that. I think it is, of course, my aim was not to demoralize it, but then better way is to know the acts. So what are there in the acts? You should know it. What you can do? You should try to follow the whatever rules, regulations, whatever things which are prescribed in the act, so that you will not be on the wrong side of the law. Okay, so that is the basic intention of this particular presentation. So if a hospital or a doctor acquaints well with these rules and regulations and follows them sincerely, I think he or she would be on the right side of the law. Okay, so there is no, he will be safeguarded under the law. Of course, when you go into this particular different knowledge or different acts, when you will go through it, you will find that there is a need for having a comprehensive healthcare act framed in order to give the entire healthcare sector to the objectives laid down by the different policies in India. So there should be certain single window system, what is called as, to start with the hospital. If I want to start a hospital, there should be a single window system, that in that particular thing you have to give whatever information you want to take. To take information in a maybe multiple pages form. The administration should take information from us. We will submit it in one window, and in that particular window they will give all the licenses, certificates, etc. So that it will be easy for us to start a hospital or to start an establishment, what is called as clinical establishment. So I think this is all for today's presentation. These are certain references which I have taken. Thank you, and all the best.
Thank you so much, sir, for your nice presentation. So, sir, can you just stop the screen share from your?
Yeah.
So, madam.
Thank you, sir, for your valuable words. I would now request Dr. Swati, ma'am, please come and share your thoughts regarding the session.
Am I audible? Yeah. So, good afternoon, students. And today we have had an excellent session where sir has already expressed regarding the laws which we all have to take care. So, being a student of medical science, already you people have a lot to study. And again, the legislative perspective also has to be looked into from the purpose where the patient who is under your observation, under your care, he is to be protected. And even your right and interest has to be protected. So when we are working into the system, there is a dichotomy of interest where how you are going to work. And now many of you may be completing your studies and you will be wanting to decide whether you want to be a practitioner in the governmental organizations, whether you have the option to open your own clinics, or you may be wanting to work with some services where multi-speciality hospitals have come. So many may be wanting to join that kind of services. So medical fraternity or medical hospital, for example, it is rendering services to the community at large. So the responsibility of the doctor, of the medical professional is to a large extent is great, and it is upon the diagnosis the medicines are to be rendered to the patient. So the patient is under the observation, under the care of the medical practitioners. So sir has already explained to us there are number of laws which are there which we require to probe into, which we require to see. And in certain instances, medical services, one cannot say that these services will not be rendered. Even in emergency, it is the responsibility of the state. That means whosoever is working under the state to provide medical services to the people or to the consumers. So under the act, that is Consumer Protection Act, which is the main enactment, we have to understand the definition who is a consumer. So basically one who is making a payment, he is a consumer. So when he is a consumer, then there are certain rights and what are the claims which a consumer can make. So the concept of negligence, when you are understanding, it is from the perspective of law of tort. It is also from the perspective of law of crime, where IPC, the provisions are there in case of gross criminal negligence. The punishments will be sentenced to the medical practitioners too. But again, there are certain defenses where in those defenses, if you are fitting into, you will be having remedies for the same. So now it is for you to decide in which kind of setup you are going to work. And accordingly, today I have seen many of the medical practitioners, they are not only studying medicine, but once you complete your course of medicine, you go for doing a management program, and under the management program or under the law program, you are explained with the legislative perspective. That is how these laws are to be made applicable. And when we are speaking of law today, we were just discussing about the national legal perspective, but we have to also understand about accreditation, how the hospitals come into ranking, what are the international standards, and what kind of safety norms and precautionary norms even the medical staff have to follow. What happens in emergency, what happens when there is an epidemic, when there is a pandemic. And we have also seen the government regulatories, the guidelines which were coming during the COVID-19 period. So no doubt all these aspects are made applicable to the doctors. It is even the responsibility of the patients to be careful, to be following the guidelines or the recommendations which the doctors are providing to the patients. So in case if you're wanting to establish your clinic, your hospital, then there are guidelines which says that what kind of norms have to be followed, what kind of licenses have to be followed, and how the functionality of the clinics will be doing, what kind of payments are to be made to the employees by the employers. So all these rules and regulations have been drafted, have been given, but ultimately the question comes of implementation, and it is for the parties to implement. And definitely today the scenario is that the ratio between the doctor and patients, it is a it's exorbitant. Okay, the difference, because 1:10 doctor, or one doctor is to 20 patients, or one doctor is to 50 or 100 patients, then obviously the pressure on the doctor is exorbitant. So we have to have paramedical services also, and we are also working in the directions of Ayurvigyan or homeopathy for that, or Unani medicines for that particular matter. And India is coming up globally with these kind of systems, indigenous systems, where home care also can be provided to the patients along with the medical care, the allopathy and the other varieties of medicines or varieties of treatments which can be provided to the patients. So when we speak of medicine, it is not only one medicine, but ultimately what kind of medicine to be given to the patient, what kind of diagnosis is done. And the more responsibility which I feel over here personally, it is more upon the doctors and the faith in which the patient builds with the doctor. So it is very much mutual, the understanding. And today we are seeing a stage has come where you can give online diagnosis, and you can also treat the patient, but definitely care and caution has to be rendered, and a right diagnosis has to be done in order to provide right kind of medication to the patients. So the responsibility is more upon the doctors. The responsibility of treating number of patients is also upon the doctor, and without losing their without losing it's a lot of stress, lot of burden which we see it is there on the doctors. But even doctors have to have good amount of patience when they are treating their patients. So nevertheless, the laws, when you are reading, you all will be reading into the same. You may go for higher studies with different kind of programs, because now we have different programs where law is being taught to the students. So there you will be seeing the healthcare laws which are made applicable to the medical professionals. Simultaneously, these guidelines are also to be read by the patients, because many times we see patients do make a false claim, and there are n number of complaints from the patients also claiming the like putting the name of the hospital at stake, or disreputing the hospital, or even the doctors for that matter, or barging into and breaking of the hospital. So these matters are also reported, and much of the things today we read it on social media, and rather than believing into fake news, we should be careful of what is exactly there, and we should be guided properly. So today I thank the management, the trustees, and Dr. Sumed and doctors over here who have invited me for this platform to have a discussion into the regulatory framework regarding healthcare and healthcare professionals. So I wish you good luck, and thank you, students. Thank you.
Thank you so much, ma'am. It was a pleasure hearing you also. Ma'am, we wanted to listen more from you. I would like to call upon Dr. Sumedh sir to felicitate Dr. Swati ma'am. Our last topic for today's webinar is Medical Laws, Courtroom Experience of the Medical Legal Cases. The chairperson for this session is Dr. Pawan Sable sir. Dr. Pawan Sable sir is additional professor and head of Department of Forensic Medicine and Toxicology at TNMC and BIL Nair Hospital. I would like to call upon Dr. Pawan sir to please come here and enlighten us with few words.
Thank you very much. Thank you very much. I'd like to request now our new speaker, Dr. Karkhanis, who is the practicing advocate in the High Court, who will be giving us idea about the courtroom experience and how the medical witnesses and other witnesses are being examined in the court, what are the common questions and how to deal with the cross-examination, the art, how the defense lawyers question us to extract some knowledge or to doubt certain cases. So I welcome our next speaker. Thank you very much.
So since we are on our last session, so before we call upon the concluding valedictory message by Advocate Amit Karkhanis, we would like to felicitate our chairperson, Dr. Pawan sir. I request our co-organizing secretary, sir, sir, webinar मुळे Dr. Dattatray Dombe sir, by giving him Thank you so much. So with that, We will be starting our last session by Advocate Amit Khanis. With that, we'll end our webinar. We are done. I know. मी काहीच करू शकत नाही त्यासाठी. उनका अटेंडेंस
त्याचा रिमोट नाही आहे आपल्याकडे, आम्ही त्याला मॅन्युअलीच बंद करतो. आता येतोय का बघ? आता बघ, आता बघ आणि सांग मला. आता बघ, आता बघ आणि सांग मला.
We are extremely sorry, there was some technical error in our last session. So we'll conclude our webinar for today here. At last, I would like to thank all of you, all the 500 delegates nationwide, the delegates who have come here in person and the delegates who have joined us online to be with us, to make this webinar a success and to make it possible for us to spread the knowledge of emerging branch of anatomy, that is forensic clinical anatomy. We hope to see you all again next year with a new concept. Good afternoon, and once again, thank you all.
अभी
किसी लेडीज को बुलाओ, लेडीज को बुलाओ। मैडम तो कुछ नहीं, ज्यादा नहीं इश्यू पड़ा। ठीक है, चलो।